respiratory disease susceptibility. So it means for the 3-year-old, yeah, they have the good links to, can be positive or negative impacts to the human health and also this human life. So that's why here the main point from this my presentation today. So we have to concern about how to conserve, how to restore this the tropical peatland forest, tropical peatlands, to avoid, to protect humans from the virus or the pandemics. So it means we have to concern about restoration and conservation of peatlands because this is very important to prevent humans from the pandemics. We can do something to replant and what's called disturbed area. We can also re-wetting for the drain area, dry area. So we can also we don't harvest wildlife, and also there's some many trees there, and yeah, everything related to the how to do conservation and restoration in tropical peatlands. So, and then the in the occasion, I also to greet to everyone here, happy Environment Day. So yeah, we have to concern about this our environment because save our forest, save our earth, and also it means save our future. Okay, I think this the overall about this my presentation. Apologize if maybe some mistake or something. Yeah, maybe I cannot give you the two details, and then we can also continue with the discussion. Okay, I give back to the Dr. Sandip. Thank you very much for this your you give me the opportunity to share this a bit information about this. Okay, thank you, and then have a nice day. Thank you.
Thank you, Madam.
Yeah, very welcome.
And of course, all of us is grateful for your nice presentation and of course presence during your busy schedule. And without wasting much time, we would now request our next speaker. Our next speaker is Dr. Shetadi. I just share my screen. Dr. Shetadi is Doctor in Education Management, Master degree in Nursing Management, Bachelor degree in Nursing also. He is the Deputy Director of Finance and Human Resource Affairs, Sekolah Tinggi ILM, Kesehatan Hang Tuah Surabaya, and Assistant Chairman of Finance and Human Resource Affairs, and of course, Assistant Chairman of Academic Affairs of Sekolah Tinggi ILM Kesehatan Hang Tuah Surabaya. And he did his master degree from University of Indonesia and his bachelor degree from Airlangga University. He has many years working experience in clinical, academic, and management through his career in private and organizations. His niche areas of interest include nursing management, nursing education, and medical surgical nursing. He has received the DP2M DIKTI 1 textbook initiative on July 30, 2011, as a senior lecturer of STICS Hang Tuah Surabaya. He focuses on nursing management and medical surgical nursing. Despite his academic credentials, his track record in research studies and year of experience are praiseworthy. So we welcome Dr. Setiadi. The stage is yours, sir.
Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Mohon izin.
Waalaikumsalam, mohon izin.
Semangat, Buket.
Yeah.
Good luck.
I will presentation for video. Skip screen. Share mana videonya? Ini video ini.
Assalamualaikum warahmatullahi wabarakatuh. Honorable of the speakers, Mr. and Mrs. Bualab. In this session, I would like to present the result of my research with the title Caring Behavior Education Model for Nursing Students. In my research, I made a framework in the form of caring behavior education model for nursing students as follows. And from this framework, I am determines 5 latent variables.
Sorry,
Namely,
Mr. Tiadi,
is
please
the value of the personality cost.
please maximize the screen, please.
Second is exogenous variable. It is the value of the exercise cost. First, endogenous variable, it is the student attitude. Second, endogenous variable is the student subjective norm. Third, endogenous variable, it is the student perception of control. And for endogenous variable, it is the student caring behavior. And each of these latent variable has the following manifest variable. 1. The grade of personality cost, X1 score of nursing ethics scores, X2 score of nursing communication course, X3 the grade of professional nursing course, X4 score of character education course, and X5 the grade of personality and career development course. 2. Score of expertise course. X6 the grade of basic concept of nursing course. X7 the grade of basic nursing course. X8 the grade KMB 1 course, and X9 the grade for KMB 2 course. And further, student attitude have two variable, compassion and competence. Student subject norm have two manifest variable, normative belief and motivational to complete. Perception control student have two manifest variable, confident control and control power. And student caring behavior have 5 manifest variable: respect for defense, human presence, knowledge and skill, connectedness, and other experience. Research methods. The research approach built and developed in the form of quantitative thought with the survey design method. It uses questionnaire and observation sheets. Estimated national model. The model is valid. The model is reliable, and the model fit. Modeling results as follow. The score of the personality cost has a significant effect on the caring behavior with the direct influence with a direct influence of 0, 1, 3 plus attitude mediation of 0, 0, 4, 3. Subjective norm of 0, 0, 19.6 and perception control score of 0, 0, 0, 7. The total effect of 0 to 8 with the count 292 is greater than the critical day value of 196 then the result are significant. School of the skill course is influence meaning on caring behavior with a direct effect of 0.40. Plus mediation attitude value of 0.32. Subjective norm value is 0.14 and the perceived control value is 0.03. The total effect is 0.89 with the calculated T value of 816. So the educational model of nursing student caring behavior is influenced generally by the value of personality courses and expertise courses. Personality course and expertise course by mediating of combination of attitudes, subjective norms, and student perception of control. It means that the stronger the knowledge and high the skill, the high the caring behavior of the student. Through a combination of mediation, along with the direct influence of attitude, the direct influence of subjective norm, and the indirect influence of student perception of control. Based on the finding of this research model, the formation and the development of caring behavior can be pursued through several systemic integrated strategies, and including 1. Integrating caring behavior education content into all courses with class-based programming design, organizational, culture-based, clinic-based, and community-based. 2. Integrating caring behavior education into daily activities on campus and practice in the form of creating an habituation of caring culture. 3. Integrating caring behavior education into all activities programmed by education management. 4. Strengthening the role of educator, practice mentors, parents, and fellow students as a source of role models. 5. Building campus collaboration, communication with various healthcare base in the application of creating caring behavior for students. Suggestion to the leadership or related institution to 1. Development of caring behavior education management in depth in the form of structuring the curriculum base, device rules, and achievements to be achieved. 2. Rebuilding the ability of lecturer and clinical supervisor as innovator and motivator for students in the learning process. 5. The implementation of caring behavior education is carried out through habituation in the context of real life on campus and practice areas. 6. Implementation by embodiment of value in attitudes, norms, and perception of student daily behavior. 7. Educational supervision by handling and evaluating caring attitudes, norms, perceptions, and behavior on regular and continuous basis by developing indicators of the established value of caring behavior. A. Supervision through rules and attitude books, recording achievement, analyzing and following up as needed. Advice for the head of nursing study program. 1. Placing the topic of caring application on students in the early and final semester. Balance theory and practice in the of material, time and learning process, where practice is more than theory. 3. Develop a learning module in the form of a caring behavior guide. Advice for educators. Educator as main actor in education and learning management must be able to carry out continuous empowerment to explore student potential. Suggestion for students. Students need to read more books about caring behavior, actively participate in seminar or training held on campus or off campus. Suggestion for follow-up research. Follow-up research to examine the effect of implementing campus culture from various nursing colleges and student caring behavior. Okay, I think it's time for me to end this tip. Well, I sincerely apologize. I will finally say it.
Thank you,
Thank you.
Dr. Setiadi. I just want to share the certificate of appreciation.
Boleh share. Apa maksudnya? Sudah.
So this is our token of certificate of appreciation to you, sir. Kindly accept.
Apa maksudnya? Oh yes, yes. Thank you, Dr. Sidit.
And also, Madam Gushwarni. Madam, you are around,
Yeah.
I think. Yes, sorry, that
Yes.
time I cannot show because computer have problem. So
Okay, thank you so much.
thank you for
Yeah.
your kind
Thank you.
presence, sir. Professor A.K. Pal, sir. Yes, sir, joined already. Okay, sir. Just I introduce you. Just 1 minute, sir. Thank you, sir, for joining. Professor Ananda Kishore Pal is professor and head of the Department of Orthopedics and Traumatology in IPG AMER, SSKM Hospital, Kolkata, India. And he was the youngest professor at the age of 42. He won A.A. Mehta Gold Medal in 2002. He also achieved the best scientific presentation of session IO ACON in 2003 and the best paper in implant section as co-author in IOA-CON in 2004. He won the Johnson & Johnson Traveling Fellowship of IOA in 2007 and SN Bakshi Gold Medal Award for Best Publication in Indian Journal of Orthopedics in 2012. Professor Pal is the author of an Atlas of Orthopedic Surgery. He also has publication in 33 international and national index journals. Also, he has a Scopus publication, many around more than 25. He is a national CME lecturer. He is a reviewer of Indian Journal of Orthopedics. He is an immediate past editor of Journal of West Bengal Orthopedic Association. He has been designated as one of the inspiring orthopedician of India in the year 2019 by Economic Times of India. And I must mention, Professor Pal visited Malaysia, I think 2019 in September before the lockdown, and we have enjoyed his talk here. And of course, also he presented in the first international conference, which was held in Jadavpur University last year. So that also have attracted, he has demonstrated physically that how we can keep away our body, means body pains away, means ahead, means apart, and also how we can make fit in our workplace. So Professor Pal, the stage is yours, sir. Thank you for joining with us.
Good morning, everybody, and good morning, Dr. Poddar, for your welcome and nice words to me. Can I share my screen, sir? Can I share my screen?
Yes,
am I visible?
Yes, yes. You make full screen, sir?
Yeah, I'm doing that. Okay, thank you. So from the environment aspects, as we have learned about the peak curves of the different environment and also the nursing education, now we have converting to our medical world where we practice in different parts. There are different systems, and I'm also being an expert in orthopedics. I have faced many challenges to cater my services to my patients in OPD as also in the ward. And nobody knows exactly what is the attitude, what should be the ideal attitude in COVID scenario to cater the best medical service. At the same time, we have to protect ourselves also our colleagues, our health workers, everybody. So this is my short experience of the last almost 1.5 years to how to cater our medical service for the patients being an orthopedic surgeon. So as also you know, there are several general measures, universal measures: social distancing, mask for all, universal evaluation like history, questionnaires, exposure, testing. Whenever required, we use that. As also treat as the positive, all the patients which is unknown, which should be considered as a positive unless proven otherwise. We have to correct our PPE, and we have to take the consent to cover the risk of exposure to COVID-19 to either party. So at the doing that, we have faced several challenges at the OPD and the orthopedic wards, and our actually aim was to protect the self first, following by the protection of the health workers, protect the patients and the relatives, provide the satisfactory treatment, prepare the effective work plan at the same time. So there are several challenges in the OPD. As you know, the IPGME at my center is being the most busy OPD and being the only referral center of the eastern part of the India. Not only part of the India, but there are several parts of the country where the patients are coming, like Bangladesh, Nepal, Pakistan, even different parts of the other parts of the world also. So on an average, we have faced about 1,000 orthopedic patients in our OPD. So it is very difficult to maintain the COVID attitude in our OPD. But still, as you can see the pictures, this is the pictures during the lockdown period. Even during the lockdown period, there are several patients has come, and we have tried to maintain the different attitude of the COVID and the protective attitude, like the movements of the patient. As you can see here, one part of the room has become kept entry, and patient is allowed to stand in one side of the room, so that the other parts they cannot be. There is less chance of contamination of if there are any positive patients remaining unknown. So we prevent the crowding as much as possible, like in this manner. But 6 feet spacing is not maintained always. There are PPE, means the most important PPE we advise is the mask, especially the single mask or the double mask, preferably in most of the cases. Substances, especially the most important substances, those are dangerous substances or which can cause harm to the health, we should be kept away from the patients. And also we have to try to impart the knowledges, not only to our health workers, our colleagues, to also our patients also. Now, it says, suppose these are the rooms of our OPD, so there are some barriers. So it is very difficult to diagnose from the distance. So the distance, from the distance, there is sometimes we face difficulty to hear the exact word or the history, and also the examination also is very important to the distance, also to the barrier. And also the discharge of the advice is also difficult from sitting in a different in a space. See, this is the patient has come, it is operated 6 months back. It is very difficult to examine here. And then again, he is asked to come close to me to examine for that. And we have examined, there is several problems the patient is having, including the stiffness of the knee, as also there are some radiograph shows some non-union of the condyles. So in that case, so this is the phases of the difficulty we faced in our OPD. Another important, very important legal perspective is the employer and the worker responsibilities. The employer and the workers have the responsibilities on the ICSEH Act, the Occupational Safety and the Health Act, which requires the employers to provide the safe and the healthy workplace, free of recognized hazards, and to follow the ICSEH standards. Workers should participate in the development and the implementation of the employer's safety, as also the health policies, and the help ensure that they are appropriate and implemented. So this is the legal challenge. Actually, we have to encourage everyone to speak up, to have a right to file a complaint with ICSEH, the state or local health department, the mayor or the police. So there's to take the actual appropriate action to be taken. So key elements, apart from these, there are system evaluation and improvement, there are family preparedness, emergency operation procedures, as also the post-pandemic recovery. Most important points we have to highlight is the management of the leadership and the employee participation. Being the unit of the head, we have to implement the policies for the leadership, as also the employee participation. We have to control the hazard for identification and assessment. We have to control the hazard of the to prevent and the control of the worst situation, as also risk the communication, education to everybody, because this is the unknown disease and unknown consequences. So we have to educate everybody, and also the training is important, because the safety of our frontline workers means it's your safety, it's mine safety. So safety to everybody. So this is the philosophical word which is spread to all over the country. So safety of everybody should be entertained. So not only the own safety, because if any member of your team is become unsafe, that means you are women's unsafe. So this is very important. Now, how to protect the workers? There are several steps, like the elimination of all the hazards. It is very difficult. Physically remove the hazard is extremely difficult. So this hierarchy of the controls is a substitution. It's very important. The replace the hazard, engineering control, isolate the people from the hazard, change the way the people work. Lastly, the protect the workers from the personal protective equipment. So if we, hello? So if you see the hierarchy of the control, most important is the elimination, which is almost impossible. But the other parts, the substitution, engineering control, the administrative control, and the PPE, that could be done. And that actually I attempted in our setup. Of which most important is the tabletop exercise. It is a discussion-based event that uses the progressive stimulated scenario together with a series of scripted injects to make the participants consider the impact of the potential health emergency on existing plans. That means it is a two-way traffic. So we have to involve the participants or the workers, health workers, and also our colleagues, our nursing personnel, as also there are patients also. So with all this, we have to prepare a white plan so that we can implement. Because if we implement any single plan from my direction, that could be very difficult to follow by the others. We have to hear the difficulty from the others also. This is basically the concept of the tabletop exercises. So a tabletop exercise stimulates an emergency situation in an informal, stress-free environment. And there are several the proposition. There's the infection prevention and the control during the healthcare when the coronavirus diseases is suspected or confirmed. There are some guidelines. So there are some guidelines we can follow. It is already published in different literature, and we have to follow these guidelines to prepare these tabletop exercises. This is actually our motto. And the purpose is basically to facilitate a group discussion. The exercise aims to examine the implementation of these IPC strategies required to prevent or limit the transmission of the COVID-19 in healthcare situations. So the general objectives are to share the information on practices on IPC associated with the healthcare for suspected or confirmed case of the COVID-19 and how these precautions could evolve based on the progress of the event in our faculty. We have to identify the challenges in bed occupancy and the staff management. Is very important. Sometimes it is lockdown. Sometimes the staff becomes a disease. Because it is not feeling well, they are not coming. So staff management is extremely important, as also the bed occupancy between the different departments. Discuss the procedures for the collecting and the handling of the laboratory specimens from the COVID-19 patients. Reassess the dead body management. It is very important because it creates a panic in between the healthcare also. And to identify the areas of the actions in your faculties based on the issues explored in the scenario and on how the scenario could play out in our health facility. Now, what is the institution or administrators can do? This is very important. So the rationing of the staffs. Initially, we planned for this rationing of the staffs in all tiers. Initially 1/3, then 50% as the population or the healthcare pressure has become increased. Majority of the meetings and classes, the educational classes, is taken online. But we have concentrated on the surface cleaned using the 0.05% hypochlorite solution, door handles cleaned regularly, dedicated medical waste and the contact waste disposal systems. It is prepared. Soap water, very good for the gloves, and that's used. And that is used for all the wards, rooms, corridors, nursing stations, elevators, and the trolley. Now, the decontamination is extremely important. Employers should develop the site-specific decontamination procedures. Depending on the workplace, decontamination may require the consultation with the health department or the use of a consultant specializing in the environment cleanup. Use of this EPA registered disinfectant is effective is recommended. Worker and the building occupant protection is essential to protect against the virus and the adverse effects of the disinfectant. Now, proper training is applied for all different tiers in different episodes by these experts, as you can see here, regarding the doffing, donning, regarding the caring of the patients, as also the transport everybody. Now, the barriers, how to take care of through the barriers. Basically, there are several barriers like the thermal check, that is there is minimal attendant queue, automatic hand sanitizer, and also the wall, which is, or hand sanitizer may be fixed to the wall. So OPD attendance per day, that is increasing day by day. All patients, if require admission, kept in isolated ward, and then in isolated ward, COVID test is done. If it is negative, sent to the general ward. If it is positive, then refer to the special ward. That is the policy we follow. As basically, this is a very, very important policy. Is one patient is equal to one relative, especially those who require some care, those that who are unable to stand or walk. Then in those cases only, we allowed the relatives, only one relative for one patient. Now, isolated doffing area we have prepared, and that's the waste. All the waste should be handled in extreme precautions, and there are some marking should be given, and so that everybody should understand what are the subjects to be disposed in which boxes, and every boxes should be closed. This is very important, and that has the attachment so without minimal touch they can be opened, and so every disposal can be made without touching this disposal bin. Now outpatients, this is non-urgent in-person clinic visits is postponed. All patients to be allowed with maximum one relative only, which is record on arrival. Like especially we have applied a paper where this everything is written, so that we curtailed the time they spent in the outpatient department. And once they filled up this paper, that paper is given to the experts, and they actually they actually see what is the name, mobile address for contact tracing if it's needed later, whether they have the travel history, whether they have a fever, whether there's any problem of respiratory diseases or like that. Non-touch thermal skin we have applied. All the patients is allowed to enter with mask and hand hygiene. It is a must on arrival. Appointment is given with staggering of timing. Apart from that, the waiting area should be spaced out like this. It is very difficult. At least 1 or 2 persons gap should be maintained in between the 2 waiting persons. Minimum required personnel only clinics is allowed. Preliminary history to include the travel. I already told. We have applied the form where he actually write as per information they can provide, like the traveling, fever, respiratory symptoms, everything else. In person, the surgical consult with decision makers only. Consider the non-operative management wherever possible, whether clinical appropriate. So some in our practice, some diseases may require some operations, some require, and that can be applied treated by the conservative means. So in this scenario, we have given the importance of the conservative means with skills which requires some technical expertise to provide the maximum benefit, apart from the operations, because in operations we require some multiple interventions and there is some risk also. Now, effective procedures is postponed preferably. So, elective procedures. Suppose there is a total hip replacement, total knee replacement. So all these are the not the emergency procedures. So actually, these are postponed in the at least 1 or 2 months till the spike has become a little bit reduced. COVID patient affected spike will become reduced. Now we have to take the detailed consent into the COVID, because there is already it is published that the persons, if they have asymptomatic carrier also, if we operate or on any life-saving surgery or anything, any elective surgery, there is a possibility of complications, as also there is some possibility of morbidity. It's at least 30% morbidity. So we have to taken care of. So detailed consent should be taken whether patient has a COVID or not. Now, administrative controls and the work practices to reduce the exposure with improved engineering is most important. So we have to enable the sick workers to stay home. So that is why we revise the policy of the absentee. So if the patient is complaining of the patient's, he or any workers is complaining of he or she is sick, even over the telephone, then we advise them without giving any applications, written application, that they can stay at the home at least for 3 days to see whether there is any complaints or not. If there are any complaints, then they have to face the general physicians, have to take the certificate, and they have to produce the certificate. So that is the revised policy of the absentee we have taken. Actually, the minimizing the contact among the workers and the clients, limiting the numbers of the staff present in the high potential exposure task, and again the training with all the persons, everybody that should be trained and also should be vaccinated. So these are the protocols we have applied. Now, engineering control is extremely important, like the ventilation. This is very, very important. Those closed spaces, especially the AC. So those spaces which has contains the air conditioner. So preferably we applied for our institutions to add some filters which can filter the the organisms. So in some situations they applied, they allowed this ventilation, this AC with some specific filter, but otherwise we can give some drive-through services like the air purifier, the plastic shields or the other barriers. There are some sneeze guards. It is not available, but I have heard it, but we have also asked for that, and also this personal protection kit This is extremely important. This engineering control, especially the high exposure potential jobs in healthcare, especially the pathology laboratories, the negative pressure isolation rooms, biological safety cameras, HEPA filtration I've already mentioned, and the ultraviolet irradiation system, germicidal irradiation system. This is also important. This is coming. We also applied, and in some parts of our institution, they have applied for that. Now, personal protection is very important. That has to be used as per the OSHA PP standard, and basically, where applicable, the OSHA PP standard requires the employers to conduct an assessment for the PPE, provide the PPE at no cost, appropriate to the hazard, train the employees on how to don or doff of the PPE, train the workers to maintain, store, and the replace PPE is extremely important. Provide the medical education and the fit testing. Now, this is a very important. There's a notion that the surgical mask can protect, but basically it doesn't. The surgical masks are not effective. Surgical masks do not fit tightly against the skin to form a seal, and that cannot filter the tiny particles such as the viruses and bacteria. That is, they are ineffective. That can be used along with the N95 to prevent these smearing of these viruses or the spores over the N95. Now, the respirators are needed when there is a potential for aerosol transmission. And an N95 respirator is the minimum level of protection to prevent the inhaling coronavirus. It is specially used in those cases where there is minor OT or there is some minor procedures are applied where the aerosol generation is a possibility. Now, there are several modern respirators. It is also available, and this is specifically used for those persons who are direct contact with these aerosol generating procedures, like the powered air purifier respirators or the half or full face elastomatic respirators. Especially, it is important for the durability, stand up for repeated cleaning and the disinfection, maintain the fit for overtime, and that is a cost saving. Now, this personal protection unit, it is some part of our OPD. We use this in this area where we suspected patients are usually examined. So these persons who are under under suspicion, they are safer to that room only for this examination by the persons which are fully protected. Otherwise, in those the persons are not clinically, they are not suffering from those this COVID infection. They are to the visitings with relatively less protection. So there are some challenges like the increasing number of the COVID-19 patients are being admitted to the hospital. Suspected cases are put in the isolation test for the novel virus. ICU is almost fully occupied with only few beds remaining free. Hospital management is considering the setup of the isolation ward, the field hospital. A number of the healthcare staff has been developed in COVID-19 symptoms and are absent and staying at the home. So there are several questions for discussion. How will you confirm if the suspect patients are infected with novel coronavirus? To which unit it is suspected? Confirm the patient. I'm not going into detail. There are several questions. Some questions is still answered. Some questions still remain unanswered. So the questions for discussions. So how will you mitigate the risk of infection from your frontline healthcare workers? How will the internal staff contents of the infected healthcare workers be managed, including the anticipating the storage of the available health workers? How will ambulation, the rehabilitation of the patients work to facilitate the discharge planning? How will the dead bodies be managed? What procedures are to be followed? How will you prepare and pack the body for transfer from the hospital? So most of the complaints, these are the basically the burning problems we have already sorted out. Now, challenges are there. Suppose this is the patient has admitted in this manner, but within the 7 days, within the 3 days, actually this is the 4th day of this patient is affected the disease. But as we have found that it is within the 3 days, patient has developed this sort of chest problem. So we have to take care of this, and we have to become very vigilant. And so suppose this is the already comorbid patients, and especially those patients, we have to become vigilant for that. This for the orthopedic side. So suppose this patient has admitted with this, And so this is after 3 weeks, when this is fit for the surgery, see how much the comorbidities the patient can develop. There are several calluses has developed, and there is also malignant is being almost completed like this. So this is, we are very much vigilant enough. We have to give some minimal medical treatment or medical surgical treatment at the moment. So at the later part of the his treatment, we may not give the exact proper treatment in this COVID scenario. So hospital administration calls a meeting to review the process in place of case numbers continue to increase. We have discussed the situations. Basically, we have concentrated on the training and the staffing needs. This is very, very important. Apart from this, environmental cleaning requirements and the bed occupancy, staffing management. Overall, we have some given the responsibility of the monitor, co-monitor, or the supervisor from different strata of our workers, from the nursing personnel, from our junior residents, from the senior residents, from our junior teachers, as also the senior teachers. We have to make the monitor by step monitor, so that if one monitor fails, then another monitor will take up. So in this way, we have to maintain this team. Now, healthcare facility identification isolation is extremely important. Most important steps to prevent the spread of COVID-19 is these procedures for rapid identification and isolation of the suspect COVID-19 cases. So now, so you have to know some basic knowledge. The transmission is open to all. So that apart from the droplet infections, the aerosol transmission is extremely important, and apart from the contact and other personals. So aerosol contact is maximally important. So we have to take care of, especially in those areas like ICU, in the closed space. So in that case, we have to take care of ourselves, our medical personnel, medical surgical personnel, nursing personnel, as also the healthcare providers. Now, another important point is the incubation period. So we have to, suppose the patient has come with a relatively asymptomatic, but within 14 days, patient may become symptomatic, because there is incubation periods of a patient that is up to 2 to 14 days, patient may have some symptoms. So we have to take care of. If there is a procedure is relatively prolonged in the hospital, we have to take care of. We can isolate for those patients regarding this. So COVID-19 can cause the mild to severe symptoms. This is also very important. So apart from the classical symptoms, we have to take, if the patient may come with a sore throat, like chills, fatigue, gastrointestinal. So these are the other symptoms. So if there is these unusual symptoms, we can very much care of. Now, what is the person under investigation? Person who has the both consistent signs and symptoms and the risk factors as follows. A potential exposure within 14 days before the onset of the symptoms, and the symptoms including the cough, fever, and the shortness of the breath. This is the suspected case, so we'll have to take care of. Increased risk of severe illness, like the COVID-19 poses the greater risk of severe illness for the patient with underlying health conditions, like the heart disease, lung disease with asthma, diabetes, suppressed immune system. Elderly have the higher rates of severe illness from COVID-19. Children and the younger adults have had the less severe illness and death, but we have to make very much care of, because they may have the excessive cytokine storm. There is increased risk of awake proning. So in case of respiratory distress, so we have to take care of these patients like the awake proning, because that cause the supine position leads to atelectasis. That proning can help the open of the atelectatic lung, that helps match ventilation and also perfusion, that improves the secretion clearance. And for that reason, we have to apply this technique. We keeping the one pillow under the head, one pillow under the abdomen, and another pillow under the foot. And we have to ask the patient to lie in this position for at least 5 to 10 minutes per hour, for at least 3 to 4 times of the day. So once the patient feels unwell, we have to advise the patient to lie in this manner, so that oxygen saturation can increase. Now, what can individuals do? Be informed and prepared, wear a mask, maintain the social distancing 6 feet, wash your hands frequently, use the alcohol-based hand sanitizer, avoid the touching your eyes, nose, and mouth, stay home when you are sick, cough or sneeze into a tissue or the elbow in this manner, as you can see here, clean and disinfect frequently touched objects and surfaces such as the cell phones is the maximum important. Now, the 5 steps to proper the hand washings. So I am giving a basic, very usual tips. So this is the scrub your hands for at least 20 seconds. That means what is that? Need a timer, but no. Just you have to chant in your mind silently. That is happy birthday to you, like this song. This if you sing this song in your mind silently at least twice, that means it will cover the 20 seconds. This is a very useful tips. We can easily use that. So for proper hand washing. Then apart from that, wet your hands with clean. You should not wipe your wet hand with any paper or like that. So you can keep your dry using a clean towel or in air. This is very safe. You can keep your hand air or just move your hand in the air so that you can easily dry. Okay, now the PPE for the jobs with high potential exposure, like the face and eye protection, gloves, gowns, respirators, especially the N95 mask, it is important. PAP are the full or half face elastomeric for the greater protection, especially in those areas where there is a production of the aerosols. This is most important. Stop the shaking hands. This is important. Visitors policy. So additional administrative controls is required for the visitors policy, like the soft barriers, including the use of the tables, ropes, signs, and the floor markings to maintain the social distancing. And most important, we already as one visitors is allowed for one patient, especially though for those patients who are non-ambulatory. Now, arrangement the equipments and the necessary substances is extremely important in the world. Like all hospital personnel must wear the protective clothing, cap, mask, face shield. Only one relative, usually I already emphasized. Patient in mask is also emphasized. Dressing like the gown, cap, mask, face shields, and gloves is the mandatory. Biomedical waste handled with the extreme precautions with some specific boxes with cover. Now, this PPE practice, there are especially three teams in our surgeons with some specific works, like the anesthetist, cleaning staff, and the surgical team. They are specifically trained for the specific PPE. Like the anesthetist, they must use the N95 face shield, fluid-resistant gown, gloves. Cleaning staff should, to prevent the droplet precautions, fluid-resistant surgical mask is face shield like this. So specific PPE is applied for the specific group of the health workers in our setup. Now, transport from the ward policies is also important. Shifting to OT is mandatory, so we have to concentrate on the patient shifting with strict protocol and the safe transfer technique, like the trolleys cleaned after the every use, changing room for the staff. Minimum staff is required to contact one patient, and the negative pressure theater is available. Most of the regular or the positive pressure operation theater is preferable now. Now, limit the staff changes between the cases is important. Care of the caregivers and the health workers is extremely important. That the care of the COVID-19 will decrease with the administration of the vaccine. So every persons who are healthcare, including all the healthcare providers, should be vaccinated in any type of vaccines. With uptake of the vaccines and continued workplace controls in the place, occupational exposure will decrease. People who are vaccinated can still be exposed and potentially expose someone else, even if they don't become sick. So a continued focus on the maintaining workplace preventing measures is important to protect the workers in all setup. So we have to take care of the mental health is also important to prevent the burnt out. This is extremely important. So to prevent the stress, there are several measures are taken. As the number of the cases in the COVID-19 increases, so does the associated anxiety and the stress. Consider the following steps. Use your smartphone to stay connected to the family and the friends. Shift from the texting to voice or the video calling to feel more connected. So keep the comfortable environment. So do more the things you enjoy doing at home. Practice the stress relief procedures whenever you feel anxiety building. So do some deep breathing exercise, or any other freehand exercise, reading, dig in the garden, whatever works, what you give some pleasure. Already prescribed all the persons to do whenever they have some leisure time in between the services. Avoid the unhealthy behavior like the excessive drinking that will just increase your anxiety afterwards. And keep the looking forward. We have to overcome. So we shall overcome this crisis. So this always think positively. So think about the plans. It's extremely important. So look up to the plans, concentrate on the plans. This is the advice we already given. Some portable containers is already given in our words that has to be properly labeled. This is extremely important because that can cause some harms from that apart from the COVID infections. Exceptions: the portable containers do not have some labeled. If only workers can handle, then only it cannot be labeled. Otherwise, every containers like the phenyl or any acids that has to be properly labeled, because so most of the persons they have become very frightened in this situation. They can cause some become harmed with these unlabeled dangerous substances in the world. So OSHA hazard communication standard is there, so that we have to follow this. That the employers are required to develop the list of all hazardous chemicals in the workplace, levels on the containers, chemical information, safety data sheets, training. Like even the hydrogen peroxide is a very important substance used for the dressing. If it is accidentally poured in some areas of the body, that can cause harm to the patient. That is why that has to be properly labeled, and that is to be kept aside. And most important is the training. This training is given in every workers in every situation, that even we are also become trained in every situations, because it's a new situation. Written program and the worker program access to the information is extremely important. These rights may be relevant to the cleaning and the disinfectants of chemicals. Imparting knowledge and the adequate training is extremely important. Information to COVID-19 is rapidly changing, so it requires training. Even all status, even the visitings, even ourselves, we require some training how to cope up with the situation. So it is extremely important. So training and drills must be hand-on, the frequent, should not be primarily computer-based or lecture. It may be physically based. It must include the opportunity to drill the actual process of the donning and doffing of the PPE and the respirators, should include the trained observer, and cover the site-specific decontamination procedures. And this is very important. This is a pathogen safety data guide training module. This is available in internet. Everybody can have access to it, and even by we use this through our administrative control to provide this information to all the healthcare providers, because this is extremely important. Because unless we follow these protocols, there's a possibility of outbreak from the iatrogenic component. So for more information, you can go through this. This is actually protocols we have in our situation, in our institutions, and catered almost 30% of our but total percent is already it is been controlled, and I think there's a hope that everybody will come out of the situation, and there is a good hope in the environment if we follow all this. So at a glance, the rules in all work settings: you have to wash hands after removing the gloves on soil, wear a mask, keep the common surface such as the telephones, keyboards clean, avoid the sharing equipments if possible, minimize the group meeting by using the phone, email, avoid the close contact when the meetings are necessary. We have to consider the telework as much as possible, limit the unnecessary visitors to the workplace, maintain your physical, emotional health with the rest, diet, exercise, as also relaxation in any form, even by seeing some cinema, by listening some song, music, or some meditation also. Thank you. So this is our team in IPG so this is my humble attempt to present my attempt so to give some healthcare provider to healthcare services to my patients. Thank you.
Thank you, sir, for your nice presentation, and of course from orthopedics, and then how to segregate the waste in what we call in the hospital waste, and also how we can take care the patients. All these aspects you have highlighted in your deliberation. We are again thankful to you for your kind presence, and I just we want to show you, give you the token of appreciation.
Thank you,
sir. Share your experience with us. Please accept.
Thank you, sir. Thank you.
Thank you, sir. So now we have coming to the end of this session, today's first session on environment and healthcare. First speaker was conserving tropical peatlands as a key to prevent humans from the pandemic by Dr. Gushwani Madam. Then Dr. Shetyadi talk about caring behavior education model for nursing students. And just now, Professor Dr. Anand Kishore Pal talk about the challenges of treating orthopedic patients in OPD ward and the ward in the COVID scenario. So all these aspects, we have here different type of environmental approach, of course, educational approach, and nursing and healthcare approach. So all this is useful to all the participants here. On behalf of participants, all the participants and organizers, I respectfully show our gratitude to all the three speakers of this session. Thank you, sirs and madam. We will take a break now, lunch break, and we will gather for our next open paper session at 2 p.m. It will be in Malaysian time 2 p.m. So Indonesian time 1 p.m. and India it is 11:30 a.m. Egypt 6 hours back 8 a.m. Nigeria, South Africa 7 a.m. So please check with your country schedule. Malaysian time 2 p.m. we will be joined back. Thank you again.
Dubai time?
Yes.
Dubai time?
Dubai time. What is the time now in Dubai? After 1 hour. You just say after 1 hour we will join.
8:52. Okay.
After 1 hour.
Okay.
Just 1 hour break.
Thank you.
So around 10 a.m. Dubai.
Okay. All right.
Thank you. Welcome.
Thank you.
Okay. Thank you, Dr. Sandeep.
Yes, Miss Devi. So you can take a break and again join back after 1 hour.
All right.
Thank you. There is a link in the chat box. Everybody, please fill the link for your attendance. And the program is also telecasted in YouTube. So you can check YouTube later on also. If anybody miss any part, you can check. I'm sharing the YouTube link in the chat box also. Thank you.
LUC, Lincoln University College. A truly global university. A top 25 performing universities in student mobility. That enhances lifelong learning opportunities, practical and scientific skills, social values, leadership and entrepreneurship. By harnessing information technology including machine learning and deep learning to create a noble, eternal, peaceful human society. Lincoln University College was established in 2002 and now has 3 campuses, which is 2 at Kuala Lumpur and 1 at Kota Baru. Lincoln University College Malaysia has been worldwide recognized by multi-rank universities, World University Ranking and also QS Asia University Ranking.
Ya, Mas. Gak bisa makan siang? Malah apa, Mas? Tapi sarapan biasa.
Suaranya Rek.
Balikan. Biasanya lah gak biasa iki.
Stikes Hang Tuah Surabaya. Di situasi pandemi seperti ini, kebutuhan tenaga kesehatan semakin meningkat. Maka dari itu, kita membutuhkan kampus yang berkualitas di bidangnya. Nah, Stikes Hang Tuah Surabaya ini telah mendapatkan akreditasi B dari Lembaga Akreditasi Mandiri Perguruan Tinggi Kesehatan yang memiliki 5 prodi unggulan yaitu D3 Keperawatan, S1 Keperawatan, Profesi Nurse, dan memiliki 2 prodi baru yaitu S1 Gizi dan D4 Manajemen Informasi Kesehatan.
Stikes Hang Tuah sendiri telah memiliki 40 dosen S2, 2 dosen S3, dan praktisi kesehatan yang sangat berpengalaman. Serta Stikes Hang Tuah memiliki fasilitas, sarana, dan prasarana yang sangat lengkap, seperti laboratorium dan perpustakaan, serta hal yang lainnya. Stikes Hang Tuah sendiri memiliki lebih dari 20 UKM, salah satunya UKM Tari, UKM Kesehatan Matra Laut, dan UKM lainnya. Dan pastinya, Stikes Hang Tuah Surabaya siap mencetak tenaga kesehatan yang unggul, berwawasan kesehatan maritim dan kelautan.
Menurut survei studi, 90% lulusan dari Stikes Hang Tuah Surabaya telah diterima dalam bidang pekerjaan mulai dari rumah sakit, puskesmas, klinik, PNS, dan BUMN. Dan lebih menariknya lagi, bakal ada free laptop untuk penerimaan mahasiswa baru yang daftar di tahun ini loh. So, buruan gabung bersama kami dan daftarkan diri kalian di www.stikeshangtuah.sby dan juga Instagramnya di Stikes Hang Tuah SBY. Stikes Hang Tuah Surabaya.
Surabaya adalah ibu kota Provinsi Jawa Timur, sekaligus kota metropolitan terbesar kedua di Indonesia. Surabaya juga merupakan salah satu kota tujuan pendidikan, khususnya pendidikan tenaga kesehatan di Indonesia yang sangat diperhitungkan. Ribuan siswa maupun mahasiswa dari berbagai daerah di Indonesia mengenyam pendidikan di kota ini. Salah satu pilar penyangga pendidikan tinggi kesehatan di kota Surabaya adalah Stikes Hang Tuah Surabaya. Selamat datang di kampus Sekolah Tinggi Ilmu Kesehatan Hang Tuah Surabaya. Stikes Hang Tuah Surabaya di bawah naungan Yayasan Nala, yaitu salah satu yayasan yang dimiliki oleh TNI Angkatan Laut, sehingga kampus kami berada dalam satu lokasi dengan Rumah Sakit Pusat Angkatan Laut Dr. Ramelan Surabaya, yaitu di Jalan Gadung nomor 1 Surabaya.
Halo?
Stikes Hang Tuah Surabaya hadir untuk memenuhi kebutuhan tenaga kesehatan di rumah sakit, klinik kesehatan, puskesmas, maupun tempat pelayanan kesehatan lain, baik yang berafiliasi dengan TNI Angkatan Laut, pemerintah, maupun fasilitas pelayanan kesehatan swasta, serta memberi kesempatan pada putra-putri anggota TNI, khususnya TNI Angkatan Laut, serta keluarganya untuk meningkatkan jenjang pendidikan tinggi, dan juga memberi kesempatan kepada putra-putri terbaik bangsa Indonesia untuk menjadi tenaga kesehatan profesional yang memiliki kompetensi, berbudi pekerti luhur, tangguh, sehat, cerdas, patriotik, berdisiplin, kreatif, produktif, dan profesional. Stikes Hang Tuah Surabaya lahir diawali dengan adanya kerjasama antara Yayasan Nala dengan Hospital Dr. Ramelan Surabaya dalam mendirikan Akper Hang Tuah Surabaya pada tanggal 7 Juni 1995. Pada pertengahan 2005, dimulailah usaha-usaha untuk merintis perubahan bentuk Akademi Keperawatan menjadi Sekolah Tinggi Ilmu Kesehatan. Dan pada tahun 2006, Sekolah Tinggi Ilmu Kesehatan Hang Tuah Surabaya resmi berdiri.
Sekolah Tinggi Ilmu Kesehatan Hang Tuah Surabaya memiliki visi menjadi sekolah tinggi ilmu kesehatan yang mandiri, bermartabat, kompetitif, berwawasan kesehatan maritim dan kelautan. Untuk mewujudkan visi tersebut, Stikes Hang Tuah Surabaya menyusun misi, yaitu pertama, menciptakan pendidikan dengan budaya akademik yang kondusif dan mampu bersaing. Kedua, mengembangkan penelitian yang berorientasi pada iptek, kesehatan maritim, dan kelautan. 3. Melaksanakan pengabdian masyarakat dimulai dari wilayah pesisir. 4. Mewujudkan pelaku pendidikan yang memiliki integritas. Yang kelima, mewujudkan penguatan tata kelola organisasi yang efektif, demokratis, dan terpercaya. Kami menerapkan tata nilai di lingkungan Stikes Hang Tuah Surabaya yang mendasari sikap dan perilaku seluruh sivitas akademika. Tata nilai yang kami laksanakan adalah cerdas. Cerdas merupakan singkatan dari nilai-nilai luhur yang kami yakini, yaitu caring, excellent, respectful, disiplin, altruistik, dan smart.
Stikes Hang Tuah Surabaya telah memiliki 5 program studi, yaitu D3 Keperawatan, S1 Keperawatan, Prodi Pendidikan Profesi Nurse, S2 Gizi, dan D4 Manajemen Informasi Kesehatan. Program Stikes adalah selalu prodi ini dibagi menjadi 2, yaitu Prodi Keperawatan S1 dan D3. Alumni Diploma 3 Keperawatan berperan sebagai perawat terampil dalam menyelesaikan masalah keperawatan secara mandiri dan berkelompok yang direncanakan sesuai dengan standar asuhan keperawatan, dengan kemampuan menerima tanggung jawab terhadap keputusan dan tindakan asuhan keperawatan profesional sesuai dengan lingkup praktik dan hukum dan peraturan perundangan. Prodi S1 Ilmu Keperawatan menyelenggarakan pendidikan akademik untuk menghasilkan sarjana keperawatan dengan gelar S.Kep yang nantinya berpeluang untuk melanjutkan pendidikan ke jenjang profesi nurse ataupun jenjang magister sesuai dengan minat masing-masing. Prodi Pendidikan Profesi Nurse merupakan perawat profesional yang cerdas dan kompeten dalam memberikan asuhan keperawatan kepada klien dan mampu melakukan fungsi manajemen keperawatan. Prodi S1 Gizi mencetak lulusan yang dapat menjadi pengambil keputusan dalam memecahkan permasalahan gizi, baik program dan kebijakan gizi, komunitas maupun sosial secara profesional dan bertanggung jawab. Prodi D4 Manajemen Informasi Kesehatan mencetak lulusan yang kompeten dalam mengumpulkan, mengintegrasikan, dan menganalisa data rekam medis serta data pendukung lainnya untuk kepentingan perawatan pasien yang efektif serta kepentingan lain seperti penelitian, pendidikan, perencanaan, dan evaluasi pelayanan kesehatan. Sarana pembelajaran yang lengkap sangat diperlukan untuk menunjang efektivitas pembelajaran offline guna meningkatkan kompetensi mahasiswa. Sarana yang terdapat di Stikes Hang Tuah Surabaya adalah lab keperawatan dasar, keperawatan medikal bedah dan gawat darurat, lab keperawatan maternitas dan anak, lab jiwa, komunitas dan keluarga, jiwa dan gerontik, laboratorium biomedik, anatomi dan ruang tutorial, lab skill yang terdiri dari 2 lantai untuk meningkatkan skill prosedur, lab komputer, perpustakaan, terdiri dari ruang baca, ruang internet, dan ruang pelayanan. Selain itu, untuk mendukung pembelajaran daring, tersedia berbagai macam video pembelajaran di website dan YouTube. Indonesia sebagai negara maritim terbesar dunia memiliki sejumlah wilayah laut, pesisir, dan pulau-pulau kecil yang luas dan bermakna strategis dalam pembangunan ekonomi nasional. Stikes Hang Tuah Surabaya dalam peranannya di bidang pendidikan kesehatan memberikan wawasan kesehatan maritim dan kelautan di dalam kurikulum pendidikannya dalam bentuk materi kuliah matra kesehatan, laut, dan udara serta dibentuknya UKM atau unit kegiatan mahasiswa Kesmala. Stikes Hang Tuah Surabaya telah bekerja sama dengan instansi untuk penyerapan lulusan, yakni Rumah Sakit Mitra Keluarga Group, National Hospital Surabaya, RSPAL Dr. Ramelan Surabaya, Siloam International Hospitals. Selain itu, kami juga bekerja sama dengan beberapa instansi untuk lahan praktik mahasiswa Stikes Hang Tuah Surabaya, yakni RSPAL Dr. Ramelan Surabaya, RSAL Dr. Sukantio Jahya Lanudal Juanda, RS Marinir Ewa Pangalila Gunung Sari Surabaya, Lembaga Kesehatan Kelautan TNI AL, Diskes Kuarmada 2, Rumah Sakit Haji Surabaya, Rumah Sakit PHC Surabaya, Rumah Sakit Jiwa Menur Surabaya, UPTD Gria Werda Jambangan Surabaya, Giponsos Keputih Surabaya, Dinas Kesehatan Kota Surabaya, Puskesmas di Kota Surabaya. Tingkat kelulusan mahasiswa Stikes Hang Tuah Surabaya. Tingkat kelulusan ujian kompetensi D3 keperawatan 96,8% Oktober 2020. Tingkat kelulusan ujian kompetensi profesi nurse 94,7% Oktober 2020. Tingkat penyerapan lulusan yang bekerja sebagai tenaga kesehatan di fasilitas pelayanan kesehatan lebih dari 90%. Tingkat masa tunggu kerja kurang dari 6 bulan lebih dari 90%. Hal ini menandakan bahwa lulusan Stikes Hang Tuah Surabaya siap untuk masuk ke dunia kerja.
Salam tangguh, salam sehat, salam kemanusiaan. COVID-19 di Indonesia telah ditetapkan sebagai bencana nasional tepatnya pada tanggal 2 Maret 2020. Pandemi ini berdampak pada semua aspek kehidupan, baik di sektor kesehatan, sektor ekonomi, sektor sosial dan kemasyarakatan, tanpa kecuali di sektor pendidikan. Kendati demikian, adanya pandemi ini mampu mengakselerasi pendidikan di era revolusi industri 4.0. Wabah corona ini justru memacu dunia pendidikan dengan mendorong lebih banyak pemanfaatan teknologi informasi dalam aktivitas belajar jarak jauh. Namun pada kondisi ini, terdapat tantangan yang besar dalam pelaksanaannya. Menjawab tantangan tersebut, Stikes Hang Tuah Surabaya dengan membentuk Satgas COVID-19 dan mempersiapkan sarana prasarana yang sesuai sebagai adaptasi kebiasaan baru dalam kehidupan kampus. Stikes Hang Tuah Surabaya siap menjadi kampus tangguh, yaitu kampus yang menyelenggarakan Tridharma perguruan tinggi dengan memprioritaskan kesehatan dan keselamatan bagi seluruh peserta didik, pendidik, tenaga kependidikan, keluarga, dan masyarakat. Saya dibantu oleh seluruh sivitas akademika di bawah koordinasi bidang 1, 2, dan 3 terus mengembangkan diri menjawab tantangan ini. Di bidang 1, bidang akademik, kurikulum dan model pembelajaran disiapkan untuk menjawab era industri 4.0 dengan memastikan ketersediaan sarana dan prasarana serta sistem informasi yang memadai, memastikan kegiatan pembelajaran baik di kelas, laboratorium maupun klinik dapat terlaksana secara blended learning dengan memprioritaskan keamanan, kesehatan, dan keselamatan. Di bidang 2, menjamin seluruh kegiatan administrasi umum dan kepegawaian berjalan dengan baik serta menyediakan sarana prasarana yang mendukung upaya protokol kesehatan yang memadai. Di bidang 3 kemahasiswaan, berbagai penyesuaian dilaksanakan untuk memastikan kegiatan kemahasiswaan baik intra maupun ekstra kurikuler dapat terus berjalan dengan memanfaatkan teknologi informasi. Pada masa pandemik ini, Stikes Hang Tuah Surabaya telah mempersiapkan diri dengan baik, menerapkan protokol kesehatan untuk mencegah COVID-19 di lingkungan kampus, kami laksanakan dengan disiplin tinggi. Stikes Hang Tuah Surabaya berkomitmen sebagai kampus tangguh.
Stikes Hang Tuah Surabaya adalah institusi pendidikan di bawah TNI Angkatan Laut yang mahasiswanya belajar di wahana rumah sakit militer, yaitu Rumah Sakit Pusat Angkatan Laut Dr. Ramlan Surabaya. Mereka mendapat pendidikan yang penuh disiplin dan bertanggung jawab, menjadikan mereka sebagai mahasiswa yang unggul. Ini mempermudah kami untuk transfer pengetahuan dan attitude kepada mereka. Oleh sebab itu, hampir sebagian besar lulusan Stikes Hang Tuah Surabaya setelah lulus dari pendidikan dapat diterima di Rumah Sakit Pusat Angkatan Laut Dr. Ramlan Surabaya, juga di rumah sakit di Surabaya dan sekitarnya. Semoga Stikes Hang Tuah Surabaya selalu jaya dan senantiasa memberikan kontribusi terbaik bagi nusa dan bangsa.
Lebih dari 20 tahun, kami berproses dalam membentuk sebuah lembaga pendidikan kesehatan untuk mencapai sasaran terwujudnya masyarakat yang makin sejahtera, lahir dan batin, secara adil dan merata. Terselenggaranya pendidikan nasional dan pelayanan kesehatan yang makin bermutu serta merata, mewujudkan manusia berbudi pekerti luhur, tangguh, sehat, cerdas, patriotik, berdisiplin, kreatif, produktif, dan profesional. Kami akan terus berkembang dan akan meraih mimpi kami, yaitu menjadi sekolah tinggi ilmu kesehatan yang mandiri, bermartabat, kompetitif, dan berwawasan kesehatan maritim dan kelautan pada tahun 2031. Mari bergabung bersama kami.
LUC, Lincoln University College. A truly global university. A top 25 performing universities in student mobility. That enhances lifelong learning opportunities, practical and scientific skills, social values, leadership and entrepreneurship. By harnessing information technology including machine learning and deep learning to create a noble, eternal, peaceful human society. Lincoln University College was established in 2002 and now has 3 campuses, which is 2 at Kuala Lumpur and 1 at Kota Baru. Lincoln University College Malaysia has been worldwide recognized by multi-rank universities, World University Ranking and also QS Asia University Ranking.
ICSEH Surabaya. Di situasi pandemi seperti ini, kebutuhan tenaga kesehatan semakin meningkat. Maka dari itu, kita membutuhkan kampus yang berkualitas di bidangnya. Nah, ICSEH Surabaya ini telah mendapatkan akreditasi B dari Lembaga Akreditasi Mandiri Perguruan Tinggi Kesehatan yang memiliki 5 prodi unggulan, yaitu D3 Keperawatan, S1 Keperawatan, Profesi Nurse, dan memiliki 2 prodi baru, yaitu S1 Gizi dan D4 Manajemen Informasi Kesehatan.
ICSEH sendiri telah memiliki 40 dosen S2, 2 dosen S3, dan praktisi kesehatan yang sangat berpengalaman. Serta ICSEH memiliki fasilitas, sarana, dan prasarana yang sangat lengkap, seperti laboratorium dan perpustakaan, serta hal yang lainnya. ICSEH sendiri memiliki lebih dari 20 UKM, salah satunya UKM Tari,
UKM Kesehatan Matra Laut, dan UKM lainnya.
Dan pastinya, ICSEH Surabaya siap mencetak tenaga kesehatan yang unggul, berwawasan kesehatan maritim dan kelautan.
Menurut survei studi, 90% lulusan dari ICSEH Surabaya telah diterima dalam bidang pekerjaan mulai dari rumah sakit, puskesmas, klinik, PNS, dan BUMN. Dan lebih menariknya lagi, bakal ada free laptop untuk penerimaan mahasiswa baru yang daftar di tahun ini loh. So, buruan gabung bersama kami dan daftarkan diri kalian di www.ICSEH.sby dan juga Instagramnya di ICSEH.sby. ICSEH Surabaya.
Surabaya adalah ibu kota Provinsi Jawa Timur, sekaligus kota metropolitan terbesar kedua di Indonesia. Surabaya juga merupakan salah satu kota tujuan pendidikan, khususnya pendidikan tenaga kesehatan di Indonesia yang sangat diperhitungkan. Ribuan siswa maupun mahasiswa dari berbagai daerah di Indonesia mengenyam pendidikan di kota ini. Salah satu pilar penyangga pendidikan tinggi kesehatan di kota Surabaya adalah ICSEH Surabaya. Selamat datang di kampus Sekolah Tinggi Ilmu Kesehatan Hang Tuah Surabaya. ICSEH Surabaya di bawah naungan Yayasan Nala yaitu salah satu yayasan yang dimiliki oleh TNI Angkatan Laut, sehingga kampus kami berada dalam satu lokasi dengan Rumah Sakit Pusat Angkatan Laut Dr. Ramelan Surabaya, yaitu di Jalan Gadung nomor 1 Surabaya. Stikes Sang Tua Surabaya hadir untuk memenuhi kebutuhan tenaga kesehatan di rumah sakit, klinik kesehatan, puskesmas, maupun tempat pelayanan kesehatan lain, baik yang berafiliasi dengan TNI Angkatan Laut, pemerintah, maupun fasilitas pelayanan kesehatan swasta, serta memberi kesempatan pada putra-putri anggota TNI, khususnya TNI Angkatan Laut, serta keluarganya untuk meningkatkan jenjang pendidikan tinggi, dan juga memberi kesempatan kepada putra-putri terbaik bangsa Indonesia untuk menjadi tenaga kesehatan profesional yang memiliki kompetensi, berbudi pekerti luhur, tangguh, sehat, cerdas, patriotik, berdisiplin, kreatif, produktif, dan profesional. Stikes Sang Tua Surabaya lahir diawali dengan adanya kerjasama antara Yayasan Nala dengan Rumkital Dr. Ramelan Surabaya dalam mendirikan Akper Hang Tua Surabaya pada tanggal 7 Juni 1995. Pada pertengahan 2005, dimulailah usaha-usaha untuk merintis perubahan bentuk Akademi Keperawatan menjadi Sekolah Tinggi Ilmu Kesehatan. Dan pada tahun 2006, Sekolah Tinggi Ilmu Kesehatan Hang Tua Surabaya resmi berdiri.
Sekolah Tinggi Ilmu Kesehatan Hang Tua Surabaya memiliki visi menjadi sekolah tinggi ilmu kesehatan yang mandiri, bermartabat, kompetitif, berwawasan kesehatan maritim dan kelautan. Untuk mewujudkan visi tersebut, Stikes Hang Tua Surabaya menyusun misi, yaitu pertama, menciptakan pendidikan dengan budaya akademik yang kondusif dan mampu bersaing. Kedua, mengembangkan penelitian yang berorientasi pada iptek, kesehatan maritim, dan kelautan. Tiga, melaksanakan pengabdian masyarakat dimulai dari wilayah pesisir. Empat, mewujudkan pelaku pendidikan yang memiliki integritas. Yang kelima, mewujudkan penguatan tata kelola organisasi yang efektif, demokratis, dan terpercaya. Kami menerapkan tata nilai di lingkungan Stikes Hang Tua Surabaya yang mendasari sikap dan perilaku seluruh sivitas akademika. Tata nilai yang kami laksanakan adalah cerdas. Cerdas merupakan singkatan dari nilai-nilai luhur yang kami yakini, yaitu caring, excellent, respectful, disiplin, altruistik, dan smart.
Stikes Hang Tua Surabaya telah memiliki 5 program studi, yaitu D3 Keperawatan, S1 Keperawatan, Prodi Pendidikan Profesi Nurse, S1 Gizi, dan D4 Manajemen Informasi Kesehatan. Program studi keperawatan adalah program studi unggulan di Stikes Hang Tua Surabaya. Kami selalu mencetak tenaga keperawatan medis yang unggul dan siap bersaing di dunia kerja. Prodi ini dibagi menjadi 2, yaitu Prodi Keperawatan S1 dan D3. Alumni Diploma 3 Keperawatan berperan sebagai perawat terampil dalam menyelesaikan masalah keperawatan secara mandiri dan berkelompok yang direncanakan sesuai dengan standar asuhan keperawatan, dengan kemampuan menerima tanggung jawab terhadap keputusan dan tindakan asuhan keperawatan profesional sesuai dengan lingkup praktik dan hukum dan peraturan perundangan. Prodi S1 Ilmu Keperawatan menyelenggarakan pendidikan akademik untuk menghasilkan sarjana keperawatan dengan gelar S.Kep yang nantinya berpeluang untuk melanjutkan pendidikan ke jenjang profesi nurse ataupun jenjang magister sesuai dengan minat masing-masing. Prodi Pendidikan Profesi Nurse merupakan perawat profesional yang cerdas dan kompeten dalam memberikan asuhan keperawatan kepada klien dan mampu melakukan fungsi manajemen keperawatan. Prodi S1 Gizi mencetak lulusan yang dapat menjadi pengambil keputusan dalam memecahkan permasalahan gizi, baik program dan kebijakan gizi, komunitas maupun sosial secara profesional dan bertanggung jawab. Prodi D4 Manajemen Informasi Kesehatan mencetak lulusan yang kompeten dalam mengumpulkan, mengintegrasikan, dan menganalisa data rekam medis serta data pendukung lainnya untuk kepentingan perawatan pasien yang efektif serta kepentingan lain seperti penelitian, pendidikan, perencanaan, dan evaluasi pelayanan kesehatan. Sarana pembelajaran yang lengkap sangat diperlukan untuk menunjang efektivitas pembelajaran offline guna meningkatkan kompetensi mahasiswa. Sarana yang terdapat di Stikes Hang Tuah Surabaya adalah lab keperawatan dasar, keperawatan medikal bedah dan gawat darurat, lab keperawatan maternitas dan anak, lab jiwa, komunitas dan keluarga, jiwa dan gerontik, laboratorium biomedik, anatomi dan ruang tutorial, lab skill yang terdiri dari 2 lantai untuk meningkatkan skill prosedur pembelajaran di website dan YouTube. Indonesia sebagai negara maritim terbesar dunia memiliki sejumlah wilayah laut, pesisir, dan pulau-pulau kecil yang luas dan bermakna strategis dalam pembangunan ekonomi nasional. Stikes Hang Tuah Surabaya dalam peranannya di bidang pendidikan kesehatan memberikan wawasan kesehatan maritim dan kelautan di dalam kurikulum pendidikannya dalam bentuk materi kuliah matra kesehatan laut dan udara serta dibentuknya UKM atau unit kegiatan mahasiswa Kesmala. Stikes Hang Tuah Surabaya telah bekerja sama dengan instansi untuk penyerapan lulusan, yakni Rumah Sakit Mitra Keluarga Group, National Hospital Surabaya, RSPHL Dr. Ramelan Surabaya, Siloam International Hospitals. Selain itu, kami juga bekerja sama dengan beberapa instansi untuk lahan praktik mahasiswa Stikes Hang Tuah Surabaya, yakni RSPHL Dr. Ramelan Surabaya, RSAL Dr. Sukantio Jahya Lanudal Juanda, RS Marinir Ewa Pangalila Gunung Sari Surabaya, Lembaga Kesehatan Kelautan TNI AL, Diskes Kuarmada 2, Rumah Sakit Haji Surabaya, Rumah Sakit PHC Surabaya, Rumah Sakit Jiwa Menur Surabaya, UPTD Gria Werda Jambangan Surabaya, Diponsos Keputih Surabaya, Dinas Kesehatan Kota Surabaya, Puskesmas di Kota Surabaya. Tingkat kelulusan mahasiswa Stikes Hang Tuah Surabaya. Tingkat kelulusan ujian kompetensi D3 keperawatan 96,8% Oktober 2020. Tingkat kelulusan ujian kompetensi profesi nurse 94,7% Oktober 2020. Tingkat penyerapan lulusan yang bekerja sebagai tenaga kesehatan di fasilitas pelayanan kesehatan lebih dari 90%. Tingkat masa tunggu kerja kurang dari 6 bulan lebih dari 90%. Hal ini menandakan bahwa lulusan Stikes Hang Tuah Surabaya siap untuk masuk ke dunia kerja.
Salam tangguh, salam sehat, salam kemanusiaan. COVID-19 di Indonesia telah ditetapkan sebagai bencana nasional tepatnya pada tanggal 2 Maret 2020. Pandemi ini berdampak pada semua aspek kehidupan, baik di sektor kesehatan, sektor ekonomi, sektor sosial dan kemasyarakatan, tanpa kecuali di sektor pendidikan. Kendati demikian, adanya pandemi ini mampu mengakselerasi pendidikan di era revolusi industri 4.0. Wabah corona ini justru memacu dunia pendidikan dengan mendorong lebih banyak pemanfaatan teknologi informasi dalam aktivitas belajar jarak jauh. Namun pada kondisi ini, terdapat tantangan yang besar dalam pelaksanaannya. Menjawab tantangan tersebut, Stikes Hang Tuah Surabaya dengan membentuk Satgas COVID-19 dan mempersiapkan sarana prasarana yang sesuai sebagai adaptasi kebiasaan baru dalam kehidupan kampus. Stikes Hang Tuah Surabaya siap menjadi kampus tangguh, yaitu kampus yang menyelenggarakan Tridharma perguruan tinggi dengan memprioritaskan kesehatan dan keselamatan bagi seluruh peserta didik, pendidik, tenaga kependidikan, keluarga, dan masyarakat. Saya dibantu oleh seluruh sivitas akademika di bawah koordinasi bidang 1, 2, dan 3 terus mengembangkan diri menjawab tantangan ini. Di bidang 1, bidang akademik, kurikulum dan model pembelajaran disiapkan untuk menjawab era industri 4.0 dengan memastikan ketersediaan sarana dan prasarana serta sistem informasi yang memadai, memastikan kegiatan pembelajaran baik di kelas, laboratorium maupun klinik dapat terlaksana secara blended learning dengan memprioritaskan keamanan, kesehatan, dan keselamatan. Di bidang 2, menjamin seluruh kegiatan administrasi umum dan kepegawaian berjalan dengan baik serta menyediakan sarana prasarana yang mendukung upaya protokol kesehatan yang memadai. Di bidang 3 kemahasiswaan, berbagai penyesuaian dilaksanakan untuk memastikan kegiatan kemahasiswaan baik intra maupun ekstra kurikuler dapat terus berjalan dengan memanfaatkan teknologi informasi. Pada masa pandemik ini, Stikes Hang Tuah Surabaya telah mempersiapkan diri dengan baik, menerapkan protokol kesehatan untuk mencegah COVID-19 di lingkungan kampus. Kami laksanakan dengan disiplin tinggi. Stikes Hang Tuah Surabaya berkomitmen sebagai kampus tangguh.
Stikes Hang Tuah Surabaya adalah institusi pendidikan di bawah TNI Angkatan Laut yang mahasiswanya belajar di wahana rumah sakit militer, yaitu Rumah Sakit Pusat Angkatan Laut Dr. Ramlan Surabaya. Mereka mendapat pendidikan yang penuh disiplin dan bertanggung jawab, menjadikan mereka sebagai mahasiswa yang unggul. Ini mempermudah kami untuk transfer pengetahuan dan attitude kepada mereka. Oleh sebab itu, hampir sebagian besar lulusan Stikes Hang Tuah Surabaya setelah lulus dari pendidikan dapat diterima di Rumah Sakit Pusat Angkatan Laut Dr. Ramlan Surabaya, juga di rumah sakit di Surabaya dan sekitarnya. Semoga Stikes Hang Tuah Surabaya selalu jaya dan senantiasa memberikan kontribusi terbaik bagi nusa dan bangsa.
Lebih dari 20 tahun, kami berproses dalam membentuk sebuah lembaga pendidikan kesehatan untuk mencapai sasaran terwujudnya masyarakat yang makin sejahtera, lahir dan batin, secara adil dan merata. Terselenggaranya pendidikan nasional dan pelayanan kesehatan yang makin bermutu serta merata, mewujudkan manusia berbudi pekerti luhur, tangguh, sehat, cerdas, patriotik, berdisiplin, kreatif, produktif, dan profesional. Kami akan terus berkembang dan akan kami, yaitu menjadi sekolah tinggi ilmu kesehatan yang mandiri, bermartabat, kompetitif, dan berwawasan kesehatan maritim dan kelautan pada tahun 2031. Mari bergabung bersama kami.
Stikes Hang Tuah Surabaya. Di situasi pandemi seperti ini, kebutuhan tenaga kesehatan semakin meningkat. Maka dari itu, kita membutuhkan kampus yang berkualitas di bidangnya. Nah, ICSEH Hang Tuah Surabaya ini telah mendapatkan akreditasi B dari Lembaga Akreditasi Mandiri Perguruan Tinggi Kesehatan yang memiliki 5 prodi unggulan yaitu D3 Keperawatan, S1 Keperawatan, Profesi Nurse, dan memiliki 2 prodi baru yaitu S1 Gizi dan D4 Manajemen Informasi Kesehatan.
ICSEH Hang Tuah sendiri telah memiliki 40 dosen S2,
2 dosen S3,
dan praktisi kesehatan yang sangat berpengalaman. Serta ICSEH Hang Tuah memiliki fasilitas, sarana, dan prasarana yang sangat lengkap, seperti laboratorium dan perpustakaan serta hal yang lainnya. ICSEH Hang Tuah sendiri memiliki lebih dari 20 UKM. Salah satunya UKM Tari,
UKM Kesehatan Matralut, dan UKM lainnya.
Dan pastinya, ICSEH Hang Tuah Surabaya siap mencetak tenaga kesehatan yang unggul, berwawasan kesehatan maritim dan kelautan.
Menurut survei tadi, 90% lulusan dari ICSEH Hang Tuah Surabaya telah diterima dalam bidang pekerjaan mulai dari rumah sakit, puskesmas, klinik, PNS, dan BUMN. Dan lebih menariknya lagi, bakal ada free laptop untuk penerimaan mahasiswa baru yang daftar di tahun ini loh. So, buruan gabung bersama kami dan daftarkan diri kalian di www.ICSEH dan juga Instagramnya di ICSEH Hang Tuah SBY. ICSEH Hang Tuah Surabaya.
LUC, Lincoln University College. A truly global human scientific skills, social values, leadership and entrepreneurship. By harnessing information technology including machine learning and deep learning to create a noble, eternal, peaceful human society. Lincoln University College was established in 2002 and now has 3 campuses, which is 2 at Kuala Lumpur and 1 at Kota Baru. Lincoln University College Malaysia has been worldwide recognized by multi-rank universities, World University Ranking and also QS Asia University Ranking.
kota Provinsi Jawa Timur, sekaligus kota metropolitan terbesar kedua di Indonesia. Surabaya juga merupakan salah satu kota tujuan pendidikan, khususnya pendidikan tenaga kesehatan di Indonesia yang sangat diperhitungkan. Ribuan siswa maupun mahasiswa dari berbagai daerah di Indonesia mengenyam pendidikan di kota ini. Salah satu pilar penyangga pendidikan tinggi kesehatan di kota Surabaya adalah Stikes Hang Tuah Surabaya. Selamat datang di kampus Sekolah Tinggi Ilmu Kesehatan Hang Tuah Surabaya. Stikes Hang Tuah Surabaya di bawah naungan Yayasan Nala, yaitu salah satu yayasan yang dimiliki oleh TNI Angkatan Laut, sehingga kampus kami berada dalam satu lokasi dengan Rumah Sakit Pusat Angkatan Laut Dr. Ramelan Surabaya, yaitu di Jalan Gadung nomor 1 Surabaya. Stikes Hang Tuah Surabaya hadir untuk memenuhi kebutuhan tenaga kesehatan di rumah sakit, klinik kesehatan, puskesmas, maupun tempat pelayanan kesehatan lain, baik yang berafiliasi dengan TNI Angkatan Laut, pemerintah, maupun fasilitas pelayanan kesehatan swasta, serta memberi kesempatan pada putra-putri anggota TNI, khususnya TNI Angkatan Laut, serta keluarganya untuk meningkatkan jenjang pendidikan tinggi, dan juga memberi kesempatan kepada putra-putri terbaik bangsa Indonesia untuk menjadi tenaga kesehatan profesional yang memiliki kompetensi, berbudi pekerti luhur, tangguh, sehat, cerdas, patriotik, berdisiplin, kreatif, produktif, dan profesional. Stikes Hang Tuah Surabaya lahir diawali dengan adanya kerjasama antara Yayasan Nala dengan Rumkital Dr. Ramelan Surabaya dalam mendirikan Akper Hang Tuah Surabaya pada tanggal 7 Juni 1995. Pada pertengahan 2005, dimulailah usaha-usaha untuk merintis perubahan bentuk Akademi Keperawatan menjadi Sekolah Tinggi Ilmu Kesehatan. Dan pada tahun 2006, Sekolah Tinggi Ilmu Kesehatan Hang Tuah Surabaya resmi berdiri.
Sekolah Tinggi Ilmu Kesehatan Hang Tuah Surabaya memiliki visi menjadi sekolah tinggi ilmu kesehatan yang mandiri, bermartabat, kompetitif, berwawasan kesehatan maritim dan kelautan. Untuk mewujudkan visi tersebut, Stikes Hang Tuah Surabaya menyusun misi, yaitu pertama, menciptakan pendidikan dengan budaya akademik yang kondusif dan mampu bersaing. Kedua, mengembangkan penelitian yang berorientasi pada iptek, kesehatan maritim, dan kelautan. Tiga, melaksanakan pengabdian masyarakat dimulai dari wilayah pesisir. Empat, mewujudkan pelaku pendidikan yang memiliki integritas. Yang kelima, mewujudkan penguatan tata kelola organisasi yang efektif, demokratis, dan terpercaya. Kami menerapkan tata nilai di lingkungan Stikes Hang Tuah Surabaya yang mendasari sikap dan perilaku seluruh sivitas akademika. Tata nilai yang kami laksanakan adalah cerdas. Cerdas merupakan singkatan dari nilai-nilai luhur yang kami yakini, yaitu caring, excellent, respectful, disiplin, altruistik, dan smart.
Stikes Hang Tuah Surabaya telah memiliki 5 program studi, yaitu D3 Keperawatan, S1 Keperawatan, Prodi Pendidikan Profesi Nurse, S1 Gizi, dan D4 Manajemen Informasi Kesehatan. Program studi keperawatan adalah program studi unggulan di Stikes Hang Tuah Surabaya. Kami selalu mencetak tenaga keperawatan medis yang unggul dan siap bersaing di dunia kerja. Prodi ini dibagi menjadi 2, yaitu Prodi Keperawatan S1 dan D3. Alumni Diploma 3 Keperawatan berperan sebagai perawat terampil dalam menyelesaikan masalah keperawatan secara mandiri dan berkelompok yang direncanakan sesuai dengan standar asuhan keperawatan. dengan kemampuan menerima tanggung jawab terhadap keputusan dan tindakan asuhan keperawatan profesional sesuai dengan lingkup praktik dan hukum dan peraturan perundangan. Prodi S1 Ilmu Keperawatan menyelenggarakan pendidikan akademik untuk menghasilkan sarjana keperawatan dengan gelar S.Kep yang nantinya berpeluang untuk melanjutkan pendidikan ke jenjang profesi nurse ataupun jenjang magister sesuai dengan minat masing-masing. Prodi Pendidikan Profesi Nurse merupakan perawat profesional yang cerdas dan kompeten dalam memberikan asuhan keperawatan kepada klien dan mampu melakukan fungsi manajemen keperawatan. Prodi S1 Gizi mencetak lulusan yang dapat menjadi pengambil keputusan dalam memecahkan permasalahan gizi, baik program dan kebijakan gizi, komunitas maupun sosial secara profesional dan bertanggung jawab. Prodi D4 Manajemen Informasi Kesehatan mencetak lulusan yang kompeten dalam mengumpulkan, mengintegrasikan, dan menganalisa data rekam medis serta data pendukung lainnya untuk kepentingan perawatan pasien yang efektif serta kepentingan lain seperti penelitian, pendidikan, perencanaan, dan evaluasi pelayanan kesehatan. Sarana pembelajaran yang lengkap sangat diperlukan untuk menunjang efektivitas pembelajaran offline guna meningkatkan kompetensi mahasiswa. Sarana yang terdapat di Stikes Hang Tuah Surabaya adalah lab keperawatan dasar, keperawatan medikal bedah dan gawat darurat, lab keperawatan maternitas dan anak,
Yeah. Okay. Okay, we will start.
Good afternoon.
Good afternoon, Prof. Sandip.
Yes,
All right.
we are
Can we start now?
going to start
All
next.
right. Well,
I think Miss Dewey will chair. I just share the screen of program. So everybody have this program schedule, I think. So there are 8 speakers, 12 speakers in this session. And session will be chaired by Ms. Dewey Priyantani. I request all the speakers to limit their speech within 5 to 6 minutes, and there will be 3 or 4 minutes for discussion. All the participants, if they have any question, can write in the chat box, and we will ask after the speaker finish the speech. We will ask the questions to the speaker, and you will reply. So please check your time that in 5 and 6 minutes you should conclude, so that 3-4 minutes we can discuss on the topic. And now I welcome Ms. Devi Antony and her team to conduct the session. Ms. Devi, please be moderator the session.
Okay, thank you, Prof. Samdek. The Honorable Professor Dr. Amia Baumik, the President Lincoln University College Malaysia, the Honorable YBAG Datuk AMB Yusuf Abu Bakar, CEO Lincoln University College Malaysia, the Honorable Datuk Dr. Haja Bibi Florina Abdullah, Pro-Counselor Lincoln University College Malaysia, the Honorable of Dr. Suryapada Poder, the President, Dr. Taraknath Poder Memorial Foundation, Kolkata, India, the Honorable Director of Sekolah Tinggi Ilmu Kesehatan Hang Tua, Ibu Dr. Ave Sri Suhardiningsih, SKP MKers, the respectable the Chairman of the International Conference, Professor Dr. Sandip Poder, PhD, and the committee, the Excellency Speaker, and all the audience. Good afternoon, everyone, and have a good day. Today, I'm Dwi Priyantini, and my Ibu Nini will be as moderator and secretary for this conference. As a schedule, we have 12 papers for this session. Before the paper presentation begins, let me inform how the presentation will be going on. First of all, the presenter will be delivered the presentation around 6 minutes.
Excuse me, just make yourself mute.
Yeah.
Miss Jonathan, Miss, make yourself mute.
Yeah.
Yes, please. Please, all participants, please make mute yourself. Okay, thank you. Miss Devi, please.
The presentation around 6 minutes. And then please mention the name and the institution also. Secondly, the discussion session will be around 4 minutes after the presenter finish present the paper. And then you may ask directly by click raise hand or write down in the chat room. And then thirdly, please mute the microphone of the audience while the presenter deliver the paper and unmute when you want to ask the discussion session. All right, without further ado, I would like to invite the first presenter to join. The first presenter with the topic correlation of knowledge and attitude to vulva hygiene practicing in student of SMPN 21 Surabaya. The presenter, Madam Puji, you may prepare the screen.
Okay, I'm ready.
All right. Time is yours. You may start the presentation.
Thank you. Okay, I want to present our research. The topic is correlation of knowledge and attitude to vulva hygiene practicing in students of SMPN 21 Surabaya. This is my team. Yeah. Nima Dewahyu Chandra Purwani, myself, and Astrida Budiarti, Iis Fatimawati, and Nur Habibah. We are from Stikes Hang Tuah, Surabaya. Background and this research, poor of knowledge, attitudes, and behavior on maintaining the reproduction hygiene will impact to women's reproduction health. Adolescent problems related to reproduction organs are lack of information, understanding and awareness in maintaining and cleaning reproduction organs. Knowledge is very influential on behavior in maintaining and cleaning reproduction organs. Adolescents who have a high level of knowledge related to maintaining reproductive hygiene are expected to have appropriate behavior in maintaining personal hygiene. The aim of study was to determine the correlation of knowledge level and attitudes to the vulva hygiene practice of grade 8 students in SMPN 21 Surabaya. The research method was analytical observational study with cross-sectional approach using cluster sampling technique with sample size of 138 students. The variables of my study were knowledge level, attitudes, and hygiene practice of vulva hygiene. In this study, data were collected by questionnaire sheet and were analyzed by using by Spearman Rowe test with level of significance of rho less than 0.05. The results showed that knowledge level is most of the respondents had a sufficient level of knowledge in the category of 64 students, 46.4%, 57 students, 41.3% who had good knowledge, and 17 students who had a low level of knowledge, 12.2%. The attitude as most of the respondents had positive attitude, as many as 136 students, 98.6%, and negative attitudes of 2 students, 1.4%. Vulva hygiene practice as most of the students had good behavior in their vulva hygiene for 137 students, 99.3%, and negative behavior by 1 student, 0.7%. The result of the Spearman Rowe analysis showed that there was no correlation knowledge level and vulva hygiene practice. Rowe is 0.583. Respondents had received information about vulva hygiene but had a lack of knowledge. This could be possible because students' lack of interest in information and the ability to absorb information received is low and lack of motivation to learn. Another assumption was that those who felt that they had received information about vulva hygiene in school but still had a low level of knowledge could be that when the information was given, they didn't focus on responding to that information. The result of the Spearman Rowe analysis showed that there was a correlation attitude and vulva hygiene practice. Rho is 0.00 first. The result of a relationship between attitudes and hygiene behavior of students' vulva hygiene because of the experience of respondents who are good at the cleanliness of their reproductive organs and their interest in using the facilities they have to carry out positive behavior in maintaining vulvar cleanliness, the better. The attitude of young women toward the cleanliness of their reproductive organs, so their behavior will also be good in applying vulva hygiene in their daily life. Conclusion in this research, the result of this study indicate that most of the students have a sufficient level of knowledge, positive attitudes, and positive behavior. The result on the Spearman row analysis showed that there was no relationship between the level of knowledge and vulva hygiene behavior, and there was a relationship between attitude and vulva hygiene behavior. Providing information by schools through audiovisual about reproduction organs so that students are more interested in listening information. Students should further increase their desire for reproductive organs, especially in maintaining clean lives to prevent bad effects such as fungi and cancer. Thank you.
Well, I'd like to open the discussion session for the audience. Is there any question? You may raise your hand by click the button in the Zoom, or maybe you write down in the chat book. Let me see in the column chat. So far, not yet. Well, maybe there is no question yet. Later on, there is a question maybe. So please write down in the chat book, and then the presenter will be answer your question. Okay, I think this is enough. The presentation completely done. Thank you, Mr. Puji, for the sharing your paper with us today. For the next, move to the next presenter. Let me see. The second presenter, the topic is the effect of hyperbaric oxygen therapy on rest and sleep need in the elderly. It's a pre-experimental study. The president of, the presenter of the article, please, Madam Habiba, proceed your presentation. Time is yours.
Thanks very much, Mrs. Dwi. Myself, my name's Habiba. I am from Matra and Hyperbaric Department of Stikes Hang Tua, Surabaya. My team are Mrs. Dian Satya Rahmawati, Mrs. Ayu Citra Mayasari, Mr. Sabto Dwi Anggoro, Mr. Tovan Agung Prasetya. And in this session, let me present our research. The title is The Effect of HBUT on Rest and Sleep Need in the Elderly. Okay, elderly tend to experience aging process. In aging process, the most of elderly get degenerative function of body and get degenerative disease, as like hypertension, diabetes mellitus, chronic pain, cancer, stroke, and etc. The most of elderly tend to present that they get decreased rest and sleep need. They are complain insomnia. They get marked by difficulty of sleeping or maintaining sleep. The most of the elderly get undergoing to HBUT. Why they get HBUT? Because HBUT have hyperoxygenation, where oxygen can diffuse to blood cell level. So blood dissolve in plasma and then the need of the oxygen in the cell is met. If oxygen in cell is met, they get rest and sleep need, so the body is get fit. The aim of the research is the effectiveness of HBUT to rest and sleep need in the elderly. Material and method. Research design was experimental, one group pre-post test, and then the research sample was elderly patient who has started HBUT at Lakesla, Surabaya. The amount of respondents was 65 who were selected randomly. And then the research variable was rest and sleep need in the elderly who did HBUT. The instrument research was used PSQT questionnaire. The data was analyzed by priority test. An ethical clearance granted by the Health Research Ethics Committee of Stikes Hang Tua Surabaya number PE/65/EE/2020/KIPK/SHT. I'm sorry. And this is the result. We have two tables. Table 1 is the demographic data of research respondent, and table 2 is the result from the sleep quality measurement of elderly before and after HBUT. Before HBUT, the elderly get value 6.63 in this bed category. The factor effect is rest and sleep need. They are psychological, environmental factor. Assume from the researcher, age of respondent were 20 until 70 years old. In this age, he has associated with natural disease and poor healthly. And the second, gender. The most of elderly who get HBUT have a menopausal. So menopausal women have low estrogen level. They often report exercise fatigue, sleep disturbance due to discomfort of hot flashes or night sweats caused by decreases estrogen level. The decreases of estrogen and progesterone have direct contribution to circadian rhythm and sleep patterns. And after HBUT, the value is 4.43. This is a good category. From the interview with the respondents, some respondents said that overall sleep quality was better, such as falling asleep and feeling refreshed after waking up. And second, to fall asleep at night doesn't require a long time. Third, their bodies felt refreshed. Fourth, in patients of diabetes mellitus, the frequency go to bathroom at night is decreased from at least 6 to 3 until 5 times. Assume the researcher that HBUT make oxygen 100% in pressure chamber of 2.4 atha flow to areas that erythrocyte can reach. It causes tissue oxygenation even without transport hemoglobin. The physiological effect of HBUT can be explained by the mechanism of oxygen dissolving in plasma. This therapy can increase the number of oxygen molecules that enter the body through breathing or pores or external tissues. So it can increase metabolism in cell and effectiveness of need for rest and sleep elderly. The conclusion of the research The conclusion of the research is the research show a significant difference in sleep quality in the elderly before and after HBUT. The quality of sleep in the elderly improved after therapy was implemented. This is the documentation from HBUT. The first is chamber hyperbaric, and the second is who elderly who get HBUT. Thank you.
Well, thank you, Madam Habibah, for the presentation. You are quite on time. Is there any question for the audience?
I have one.
Yeah. Oh,
May I?
Dr. Sandip?
Yes, yes. Just
Yeah, please.
Want to know how it is working. Means how it is a chamber or what? I have no idea. Yes, yes. This one is chamber and we are giving the oxygen.
Yes, Mrs. Habibah, please answer.
Yes. In this picture, this is a simulation of in the chamber get oxygen.
Means
one set is 10 no for the minute is 2 hours.
So 2 hours we give the
Yes.
oxygen there. Okay, okay. And it is improving the the sleep quality. Means sleep will be more after we give. You find that means positive relation that if we give the oxygen, then the person will get more sleep.
From the elderly, they are say that after 3 or 5, they get a response for their bodies.
Okay, thank you.
Maybe Prof. Sandip will give another question or maybe give a comment in the chat box. Yeah, later on. All right, I think it's enough for the presentation for the presenter too, Madam Habibah. That's a nice and interesting topic for further research in the next session. All right. Okay, thank you, Madam Habibah. For the next presenter is topic 3, the effect of sambiloto to cholesterol level on Vista rat with atherogenic diet. The presenter, Madam Rizky or Madam Ari, please proceed the presentation.
Okay, thanks for the time to given us. Okay, here I represent my team in nutritional department to present our research with the title is effect of Sambiloto and grapes paniculata to cholesterol levels on Vista rats with atherogenic diet. Okay, next. We have some background that become our motivation to take this research. The first background was from the case magnitude in our country that threatening the health status in Indonesian people. From previous research that conducted by government record that in 2013, the prevalence of hypercholesterol was so high, about 39.6% in women and 30% in men. And then, in addition, in 2015, WHO claimed that worldwide death caused by heart attack and vascular disease by 45%, and the point case for death rate in Indonesia due to heart attack is about 12.9%. For the second point related with food consumption, effect to hypercholesterol is the consumption of high fat, low fiber, and then antioxidant that affect to atherosclerosis disease that is possible to be stroke, heart attack, and gangrene. And third point, as previous research, some researchers have found the active compound in herbs is named flavonoids. Flavonoids can help to inhibit the absorption of fats that indirectly help lowering cholesterol levels. They found flavonoids in some herbs, and one of them in EPL, Andrographis paniculata. For the next, we can call EPL, that used as a biopesticide before. EPL, next. EPL is a medicinal herbs in Indonesian called as sambiloto, in Indian called asamese or kalmek, Malaysian called hempedu bumi. Next. It is easily grows while in our garden. It is like a 3-in-1 plant, wildflower, weed, and medicinal plant. And also it is a bitter. And so hardly ever people would consume this plant directly. Next. And for this research is looking at the effect of the EPL2 on decreasing cholesterol level in mice given an atherogenic diet. Next. And we conducted this research by experimental study by giving atherogenic diet. Atherogenic diet is defined increasing the cholesterol total level by feeding the mice with high-fat diet. We made symplesia from EPL leaf become dry form. The dry EPL heated with water, we call aqueous here, at 100 degrees Celsius for 5 minutes. For animal experiment, we use male Wistar mice divided into 5 groups. Normal diet as negative control, we not giving any intervention, and high fat diet as positive control, and then 3 groups with high fat diet with the dose of APL for 60 days. Next, we also measure day by day the body weight of mice as ethical procedure. In the 6 days, 1 days, we did blood tests of mice for the cholesterol level. And then we process the data by statistical analysis such as bilinear regression test to prove the effect of EPL in lowering cholesterol level. For the result, we can demonstrate with the linear graph in the screen. Okay, the result we shown about the treatment groups and cholesterol serum level. We can see that in the negative group that we don't give any intervention to them. The positive group that we fed with high-fat diet, the cholesterol level in positive control is higher than negative control. And also, we can see that cholesterol level decreasing as well as the dose of APL. So we can conclude from this test that the smaller the dose of APL leaf staves given, the greater the cholesterol level in the blood of Wistar mice. Yes. If because of a 3 active compound in staves, APL staves given to the mice, such as flavonoids. Flavonoids inhibit the oxidation of human in low density lipoprotein, inhibit platelet aggregation in the blood, affect cholesterol metabolism directly in heart, tannin, reduce oxidative stress of macrophages, and inhibit the formation of atherosclerosis. And then tannin also protect the intestines against unsaturated fatty acids. And the last active compound in APL is saponin. Saponin form complex bonds that are insoluble with cholesterol in the intestines so that the cholesterol can be absorbed. Combined with bile acid and exogenous cholesterol and increase exogenous cholesterol by fiber. Next. Beside of the treatment and then cholesterol level, we have data about increasing the body weight in the mice. So we can conclude by this linear graph, is APL still increase body weight of mice significantly. Next. So for effectiveness of this research, IPL can increase body weight in the mice about 67.6%. And then EPL can decrease cholesterol level for 33%. Next. This is our documentation in our experiment from we made Simplicia and then we did treatment to the mice group and then we did blood sampling. Okay, that's all our presentation. We are welcome for any suggestions. Thank you.
All right, Madam Ari, thank you for share. Well, I think it's an interesting paper to share because based on the result, we know that the sambiloto can decrease the cholesterol level. However, it also increase body weight of the rat. Yeah, I think this is interesting to follow up for detailed laboratorium tests in human. Do you think, Mrs. Rizky? Well, I like to open the discussion. Is there any question directly to the presenter or in column chat in YouTube?
Excuse me, Miss, can I ask some question?
All right.
Okay.
Sorry, yeah, I will try to answer. Ms. Dwi, thank you for your response and question. For increasing body weight in the mice, actually, it is like this variable. It's not in our research, not mainly in our research because we main research is main variable research is cholesterol level. But due to we have to measure the body weight too for during the treatment, so we get data about the body weight rats. And as we know that in Indonesia, the traditional people make jamu in Indonesian. What it is in English? Maybe it is like traditional medicine from Indonesia, from sambiloto to increase body weight in the human. And maybe it is like we will appreciate will there's any researchers to continue our research about the effect of IPL or sambiloto to the body weight.
All right, thank you. I think there is a one direct question from Siti Aisyah.
Okay, thank you, Miss.
Yeah.
Okay, excuse me before introduce myself. My name is Siti Aisyah. So I was a nursing student in Stika Sangtua Surabaya. So based on the presentation of Miss Rizky, how many percent of this bitter plant has proven to be able to reduce or treat several diseases, such as like Miss Rizky said, how many percent of sambiloto can be effect of the treat of disease? Thank you.
I'm sorry. I have to declare and explain again about our M research. In our research, we only to measure the effect of sambiloto between cholesterol level and dose of EPL, like this. And not we not measure about the effect this APL or sambiloto with the disease.
Okay, I see. Okay, thank you, Miss Rizky.
Okay, I think Miss Aisha already got the answer. All right, so far in column chat, no? Okay, I think it's enough, the presentation and completely done. Thank you, Madam Ari, for share your paper.
Okay, you're welcome.
All right, next to the next presenter, the fourth, the topic is effect of a herbal therapy, steeping salam leaf to decrease the blood glucose level in elderly patient with diabetes mellitus in the village of Sidoarjo, Sukodono.
Okay.
Please proceed. The presenter, Madam Dia Sustrami.
Okay, thank you, Miss Dwi.
All right.
Okay.
Time is yours.
Okay, I try to share screen. Okay, Miss Dwi, can you see my PowerPoint?
Yeah, for share screen.
Of course. Yes, Miss.
Okay.
All right, got it.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Thank you for the time. I try to present our research with title Effect of Herbal Therapy Steeping Salam Leaves Leading to Decrease in Blood Glucose Level in Elderly Patient with Diabetes Mellitus in the village of the Sub-District Sidoarjo Regency Sukodono. Our team is Miss Hidayatul Syakdia from College Nursing Stikes Hang Tuah Surabaya, Indonesia, and me, Dia Susrami, and the third author is Yoga Kertapati. Diabetes mellitus is a group of metabolic disease characterized by hyperglycemia that occurs due to abnormalities in insulin secretion, insulin action, or both of these definitions according to the American Diabetes Association. Diabetes mellitus is a metabolic disease most often occurs in the elderly due to decreased function of the pancreas, which produce insulin function. The World Health Organization also predicts an increase in the number of people with diabetes mellitus in Indonesia from 8.4 million in 200 to around 21.3 million in 230. Likewise, the International Diabetes Federation, IDF, in 209 estimates an increase in the number of people with diabetes. Diabetes mellitus is caused by disturbance in regulating glucose levels in the blood and disruption in the process of transporting glucose from the blood into cells. The older the age, the function of the pancreas decreases and the body's insulin ability to manage blood sugar is getting weaker. The elderly do not know how to avoid diabetes mellitus and how to control blood sugar levels when they suffer from diabetes mellitus. The therapy used is only medical drugs that are obtained when they come to the health services for the elderly. And herbal therapy for stiffing by leaves is an alternative way to control blood sugar levels in people with diabetes mellitus. The elderly do not know the correct procedure for making by leaf steeping and herbal therapeutic dose to reduce glucose levels in the blood. This therapy does not cause side effect in the elderly because this herbal therapy has been proven safe, which has been proven from previous studies. Okay. The materials and the method for this research. This study designed a pre-experimental design, one group pre and post-test design. Samples were taken using purposive sampling and obtained as many as 28 elderly. The independent variable is the herbal therapy sleeping salam leaves, and the dependent variable is blood glucose levels in the elderly. And the glucose research instrument used for the measurement of blood sugar levels, test data analysis using pair t-test. And the result we can see in the PowerPoint identification of respondent and the blood glucose level pre-intervention average on 183.2 and blood glucose level post-intervention on 157.8. So the results show that the steeping salam leaves for lowering blood glucose level in elderly people with diabetes mellitus is evident by the result of pair t-test. So significancy on 0.00 before and after the treatment groups. And the conclusion saying the result of the study can be concluded that the steeping salam leaves containing astringent compound can affect insulin sensitivity, thereby stimulating the parasympathetic autonomic nerve stimulation and stimulate the release of insulin from the pancreas gland. Furthermore, the public are advised to be used as an alternative way to control blood sugar levels. Okay, thank you very much, Ms. Dwi.
All right, thank you, Madam Diaz. You are right on time also. Well, I'd like to open the discussion. Is there any question directly to presenter? Please raise hand and click the button. Okay, column chat? Not yet. All right. So far, there is no question yet, Madam Diaz. If there is any question later on, they will be right down in the chat, and please answer the question from participant. I think it's enough for the Madam Diaz paper. Okay, thank you, Madam. Next, we're moving to the next presenter with the topic, a study to assess the knowledge and practice on face mask use during COVID-19 pandemic among graduate nursing students in selected institution. This is an online survey. Please, the team, the author, Mahuya Karmakar, please share screen.
Thank you.
All right.
Thank you. Am I audible?
Yeah. You may share your PPT.
Yes. Let me share my PPT. Is it visible?
Yeah. You can full screen, please.
Full screen.
You can click in the below on the right.
Okay,
Yeah.
is it okay?
Okay, good. Time is
Good
yours.
afternoon, one and all. I am Shomusri Sarkar, Associate Professor, Peerless Institute of Nursing, India, and my colleague, Ms. Mohua Karmokar, Professor, Peerless Institute of Nursing, has conducted this study. I express my heartfelt gratitude to the organizing committee for giving me an opportunity to present my research paper here. The problem statement is a study to assess the knowledge and practice on face mask use during COVID-19 pandemic among graduate nursing students in selected institutions and online survey. Background of the study is on 11th March 2020, COVID-19 was declared as a global pandemic. It was evident that spread of COVID-19 may be prevented by adopting measures like hand washing, physical distancing, and using a face mask. So correct knowledge and practice towards face mask use during COVID-19 among healthcare professionals is highly needed. Next, the objectives. Objectives were to find the level of knowledge among nursing students on face mask use, to find out the practice of face mask use among nursing students, and to find out the correlation between level of knowledge on face mask use with selected practice. The assumptions was nursing students may have some knowledge and practice regarding face mask use. Operational definition, nursing student, a person pursuing nursing degree course of age 17 to 55 years who may or may not have a registration number to practice nursing. Knowledge regarding face mask use, level of knowledge among nursing students on face mask use as measured by the structured knowledge questionnaire. Practice regarding face mask use, level of practice among nursing students on face mask use as measured by the structured practice questionnaire. Selected demographic variable are age, year of nursing study, previous knowledge. Variables are research variable, knowledge and practice of nursing students pursuing graduation course, and demographic variables are age, previous knowledge, present state, year of nursing studies. Delimitations was nursing students pursuing graduation course of age group 17 to 55 years. The conceptual frameworks was based on Rosenstock health belief model, and it includes individual perception and factors, but likely to action and cues of actions was avoided. The methodology is quantitative research approach, and research design is descriptive survey design. The setting was Peerless Institute of Nursing, India. For pilot study, I have taken 10 students and 91 students were selected for the final study, excluding the sample of pilot study. Sample is 91 nursing students pursuing graduation course in Peerless Institute of Nursing, and sampling technique is non-probability purposive sampling. Data collection tool was structured questionnaire of 25 items, which includes 10 items from background information, 15 items on knowledge level, and 10 items on practice. Data collection procedure was held in Peerless Institute of Nursing, Kolkata, India. And before the final data collection, necessary permission was sought from the ethical committee of our college, and entire data collection was done from 15th January to 31st January by online survey method. Data analysis was done by descriptive and inferential statistics. Now the results. The major findings related to sample characteristics. It was evident the majority of the participant was age group between 18 to 22, that is 60%, and majority of the participant presented or stay is urban, that is 62.64, and it was evident that majority of the participant, that is 97%, has previous knowledge regarding face mask use. Next, the knowledge level. We have categorized the total knowledge level in 3 categories, that is inadequate, moderately adequate, and adequate level of knowledge. And in the study, it was found that 84.62% majority of the participant has moderately adequate knowledge, that is 84.62%. Next is the practice. Major finding related to the practice. It was evident that 64.83% of the participants reused the fabric mask after washing and drying. 84.63% of the participants never removed the face masks during clinical duty. It was evident that 57% of the participants discard the used face masks in yellow bag, and 50% of the participants always reuse the surgical mask after washing and drying. It was evident that only the 40% of the participants use the proper holding of the face mask, that is, holding the face mask in the strings at airlobe. Next, 60% of the participants use hand hygiene before using mask, and 66% of the participants use hand hygiene after using mask. It was evident that 74% of the participants hang the face mask near the neck when nobody is there in surrounding, and 60.43% of the participants touches the outer surface of the mask without proper hand washing. It was evident that almost 50% of the participants never perform or never check the N95 sealing before using the mask, respirator mask. Next is the relationship between knowledge and selected practice. So knowledge score and selected practice, that is hanging face masks near the neck, it was evident there is a moderately negative correlation, as well as knowledge score and the selected practice touching the outer surface of the face mask without hand washing, they are also negatively correlated. So discussion with the other study. In our study, the respondent had moderately adequate knowledge and lack of practice regarding face mask use in selected area. This study result was supported by the study of Kumar J. and et al., who had studied on knowledge, attitude, and practice of healthcare workers. And this study shows the healthcare worker has a positive attitude, but moderate to poor level of knowledge and practice. Implication of the study can be used to improving the knowledge and practice regarding face mask use by different educational program and awareness program. Awareness campaigning regarding the proper use of face mask by utilizing all social media available resources would be helpful during the pandemic. Limitations of the study was, it cannot be generalized because it is conducted on the one nursing institute. The study was confined to small number of nursing students pursuing graduation course, which was also a hindrance, and participation of the study was selected through purposive sampling. Recommendations for the study: a similar study can be replicated in a large sample for generalization. A similar study can be replicated on GNM nursing student. A study can be conducted to assess the knowledge, practice, and attitude regarding the face mask use. And a study can be carried out on a large sample size on both diploma and graduate nursing students in both private and government hospitals. So we can summarize that the result shows majority of the students has moderately adequate knowledge level, but lack of practice regarding the face mask. The result of the statistical stage shows that there was moderately negative correlation between knowledge level and some selected practice. We can conclude, though knowledge score of the students are moderately adequate, but practice is lacking. Awareness campaigns regarding the proper use of face masks by utilizing the social media available resources would be very helpful. Okay, thank you.
Okay, thank you, Madam Sumasri Sarkar. That's interesting because this is relevant with our condition now, the pandemic. So I would like to open the discussion. Is there any question directly in the chat room?
Hello.
Okay.
Hello, I have a question.
All right.
Hello, Madam Shomusri.
And open the video,
Yes.
please.
Actually, I am Ruma Roy from Kolkata. Shomusri, you have done a very good presentation, but only one thing I want to know, that you have checked the practices, no, selected practices.
Yes.
So I want to know, that is, you are just it is from online survey, or you are doing in the face to face?
No, actually it was an online service.
That is why I am asking, the practice you have checked, it is
Yes.
through online, no? So this is the like survey type of practice.
Survey
is it?
type of course.
Okay. That I wanted to know. Thank you so much.
Thank you.
Good presentation.
Thank you.
Very good.
Okay, thank you for the question. Is there anyone? Not yet. Okay, thank you very much, Madam Sumarsi Sapa, for the paper presentation. This is completely done for the presenter. And then for the next presenter is related with the topic knowledge and attitude. A study to assess the occurrence and correlation of anemia with dietary practices among adolescents at the selected school Agartala, Tripura. The presenter, please.
Good afternoon, everyone.
Yeah. All right.
Myself, Snigdha Deb. I am from Kolkata, and I am here to present the study to assess the occurrence and correlation of anemia with dietary practices among adolescent girls at selected school, Agartala, Tripura. So
Sorry.
here I'll start.
Sorry. Would you little bit louder and then share screen?
Sure. I am trying to share the screen right now.
Take the mouthpiece little closer to your, then sound will go.
Yes. Okay, so here I am going to start my study.
Yeah, okay.
So the statement of the study is a study to assess the occurrence and correlation of anemia with dietary practices among adolescent girls at selected school, Agartala, Tripura West. The objectives of my study was to determine the occurrence of anemia among adolescent girls, to identify the dietary practices of adolescent girls, to assess the correlation between anemia and dietary practices among adolescent girls, to determine the association between occurrence of anemia among adolescent girls with their selected demographic variables. So the assumptions were girls are more likely to suffer from anemia. Dietary practices may affect the hemoglobin level. The methodology I have done, the research approach is quantitative research approach, the research design, correlational survey research design. The pilot study I have done in this place, Chaudhuri Girls Higher Secondary School, and the main study was done in Bojang Girls Higher Secondary School. The population was school-going adolescent girls. The sampling technique was probability sampling technique, under which the simple random sampling technique. The sample size was 100. The data collection method, demographic proforma, checklist, and Sally scale, which was a standardized tool. And the rest of the further things was done by data analysis and interpretation. So the data collection tool, the number one was background information. We have used their demographic proforma, which is paper and pencil technique. The content validity was done by 9 experts. Then the dietary practice checklist for iron intake, iron-rich diet intake, which was also a paper and pencil technique. The content validity was done by 9 experts. And to assess the hemoglobin level, I have used the Sally scale, which is in vivo biophysiological measurement. Content validity was done by 9 experts. The data analysis and interpretation. In the section 1, the frequency percentage distribution of adolescent students by their demographic variables. We have seen that the 50% of students were under 12 to 13 years, and rest of the 50% was under 14 to 15 years. Then the religion, majority of the person were Hindu religion, that is 89%. And the educational qualification, though I have selected this class for 4 batches, so each of them were having 25%. The monthly income, majority of the participants were having their monthly income more than 20,000 rupees. The food habit, 100% of the participants were non-vegetarian. Then the time of menarche, most of the students have reached their menarche between 12 to 13 years. That is quite evident. And the duration of menstrual cycle, 80% of the participants were having their duration of menstrual cycle is 5 to 10 days. Then history of menstrual bleeding, 96% of the students were having their history of menstrual bleeding is normal and regular, and only 4% were having excessive and painful menstruation. Then regarding the information of anemia, 80% of the students were aware of the topic anemia, but 20% were unaware. Then the source of information among this 80%, most of them have got their information from the health workers. Then for the rest, occurrence we have calculated. For the occurrence, total number of detected anemic adolescents into 100 divided by total number of adolescents of selected geographic area. So throughout the calculation, we have got the result is 18.8. The next is classification of respondents' dietary practice. Here we have categorized the dietary practice in 3 categories, that is inadequate, moderate, and adequate, and which is done for this iron intake. So here it is clearly seen that below 15 mg per day was the range where they are having the inadequate iron, and most of the students were having the inadequate dietary practices, that is 64%, and 36% were having the moderate, and there is 0% for adequate. Then description of calculated chi-square value, DF, tabulated chi-square value. The first one is age. That calculated chi-square value is 8.31 in degree of freedom 1. And then educational qualification was 5.31. Duration of menstruation was 4.76 and menarche 4.68. Then information about anemia 1.41 in degree of freedom 1, where the tabulated value is 3.84, which is non-significant, and the source of information 0.38. The degree of freedom is 1, it is also non-significant. The rest of the demographic variables, that is religion, monthly income, and history of menstrual bleeding, respectively, we can see the calculated Yates calculation value is 1.22, 0.016, and 0.26, which is clearly non-significant. Then the result, the demographic variables such as age, educational qualification, duration of menstruation, menarche shows significant association as the calculated chi-square value is more than the tabulated value at 0.05 level of significance with degree of freedom 1. The other demographic variables such as information of anemia, source of information about anemia does not show significant association as the calculated chi-square value is less than the tabulated value at 0.05 level of significance. For the demographic variables like religion, monthly income, history of menstrual bleeding does not show significant association as according to Yates correction method, the calculated value is less than the tabulated value at 0.05 level of significance with degree of freedom 1. So to conclude the study found that majority of the students were under inadequate dietary practice. However, there is a correlation between anemia and the selected demographic variables. Thank you so much.
Well, thank you, Madam Sinodep. It's very informative related with the teenager, right? Is there any question for the audience? Let me check in the chat book. Okay. Well, it's interesting.
I have one.
All right, thank you. Please.
Just to any relation you check with means other anemia, no only dietary anemia.
Sir, I have done my research only on dietary because in recent studies, I have seen that most of the students, those who are suffering from anemia, they're having this poor dietary practices on. Other things, other types of anemia, I have seen very less history on that.
But sometimes it happens that like you are in Tripura,
yes, sir.
Agartala, I think from Agartala data you are showing. So Agartala is affected with hemoglobinopathy E disease. So
yes,
that is hemoglobin, that is a very prevalent in Northeast India. So there should be a relation in aspect of that. So when
yes,
we are
sir.
discussing on dietary anemia, we should think about that aspect also.
Yes.
Later on, maybe include in your study.
Yes, sir. Definitely.
Thank you.
Sir. Thank you.
One question from my side on.
Okay.
Yes, ma'am.
Please, Madam.
Actually, what you say that the dietary practice, I think it should be operationally defined, because you are doing the dietary practice in your Tripura, and also dietary practice may be different in different region.
Yes.
So I think if you just try to operationally define what all the practices included in as a dietary practice, that I think that will be very clear to us.
Yes, ma'am. Actually, I have primarily focused on the iron deficiency thing. So
But
operationally,
what all dietary practices which is related with iron deficiency, that must be clarified.
okay, yes, ma'am. Yes, ma'am. That after doing this study, I have given one health talk regarding this, whatever dietary practices they can include, like iron-rich food, fruits, then vegetables, whatever was there. I have included these things in my study.
I think I wanted to say that all the elements or the components of the dietary practice, it should be in your tool, so that you can easily understand what all the different deficiencies are there, or what all the dietary practices they are doing from the other regions. So you can differentiate from it, can be comparable with the other regions also. No, that is I am asking.
Yes,
If it
ma'am.
is
Yes.
Maybe I can clear that what Madam Ruma Roy telling is you suppose you are using 24-hour recall method. So
Yes.
suppose it is population wise, it all vary. The dietary pattern also vary. So like non-vegetarian, vegetarian, then economic, economic.
Yes.
And
Can I ask one question?
So
Wait,
accordingly,
please.
it should be varied. Yes. Yes.
Yes. Snigdha, if you could show your operational definition for dietary practice, that would clear, I think, our queries.
Okay, ma'am, can I put this in the chat box directly?
Or you can read out?
Yes, I can read it out.
Yes.
The dietary practices in this study, dietary practice refers to the daily intake approximately, that is 4 meals by the students for 24 hours, assessed by the recall method. And for this dietary practice, I have taken the normal dietary practice, whatever is available according to that location or the geographical area.
Yeah, so I think the practices suffice from the operational definition.
Yes, actually, this operation definition is not given by the students, so that is why it cannot be clarified or cannot be cleared enough. So that is my question. Okay, now it is clear what is the dietary practice she want to show.
Thank you.
Thank you.
Okay. Well, there's a interactive dialogue, and then this is a interesting topic. And thank you for Madam Roma and Maharia and Prof. Sandeep.
Thank you.
Yeah, thank you. All right. I think the discussion session for the presenter, Miss Signadep, already done. Or maybe there is a raised hand here. Madam Ari, I saw in the chat room. We want to do the
Again,
direct.
sorry. Actually, I raise hand for the next, for the last. Actually, my question is same with Mrs. Rumaroy about how you can measure the dietary practices, but it can make sure to us now. Thank you.
Okay, I think the answer already done, right? This similar question with the previous participant. Thank you.
Thank you.
Yeah. All right. I think it's enough for the presentation, Madam Signadep. The next presenter, moving to the next presenter with the topic knowledge and attitude on face mask using during COVID-19 pandemic among diploma nursing in selected institution, an online survey. Please proceed. The presenter, you can share screen.
Thank you. Good afternoon, everyone.
Okay,
I am
good afternoon.
Sarkar and my colleague Mohua Kormokar from Peerless Institute of Nursing. We are done this research study. So,
I express my heartful gratitude to the organizing committee for giving this opportunity for presenting my paper.
Please share the PPT. Full screen, please. Okay, time is yours.
Okay, so go with my problem statement. So my study, knowledge and attitude. Sorry, it's disconnected. Okay, start with my problem statement. Knowledge and attitude on face masks used during COVID-19 pandemic among diploma nursing students in selected nursing institution on online survey method. So my background of the study, information about fever and pneumonia of unknown causes from China, Chinese authorities in Wuhan, China were received on December 31st, 2019, and the coronavirus was shown to be the positive organism according to WHO. Face mask use is considered as a cheap, effective, and safe method with minimum disruption in day-to-day life. So according to WHO, they validated the face masks are an effective method to prevent respiratory infections from coronavirus. So nurses in the hospital unit are present around the clock, which always allow first-hand contact with patients and their relatives to respond to their problems and risks, according to Aiken et al. 2002. So the purpose of this study, the current study will provide a comprehensive assessment of the knowledge and attitude of the diploma nursing students towards face masks used during COVID-19. Next, the objective, to find out the level of knowledge among diploma nursing students on face masks use. Next objective is to find out the correlation between level of knowledge on face masks use with selected attitude factors. Assumption, diploma nursing students may have some knowledge and attitude towards regarding face mask use. Delimitation of the study, diploma nursing students of age group 17 to 35 years. Methodology. My research approach is quantitative research approach, and my research design was descriptive survey research design. Setting, two different settings from pilot and final study are chosen. Pilot study, Newtia Academy of Nursing, Kolkata, and the final study, Peerless Institute of Nursing, Kolkata, West Bengal. The administrative written consent will be taken from participants and concerned authority. Sample, 98 diploma nursing students, and sampling technique, non-probability purposive sampling technique will be used. Data collection tool, structured questionnaire of 39 items were used, comprising of 10 items from demographic variable, 15 items from on knowledge regarding face masks use, and 14 items on attitude regarding face masks use. Method of data collection, online survey using structured questionnaire on knowledge and attitude towards face masks used during COVID-19 pandemic. Data collection procedure and plan. The setting for pilot and final data collection in nursing institutes of Kolkata, formal permission will be sought from respective institution. Data collection will be done from 1st January 2021 to 15th January 2021 throughout online survey technique. Data analysis. Data will be analyzed by using descriptive and inferential statistics. Next, come to my result findings. So, in my study, major findings I found in knowledge level, it shows among 98 diploma students, there are 70%, 75% of them having moderately adequate knowledge and 8% of them having inadequate knowledge and 17% of them having adequate knowledge. Next, the major findings from the correlation. So, in correlation, describe the relationship between knowledge and selective attitude, like I do not like to you wear a face mask. Here I found the result R value is minus 0.67. It shows there is a moderately negative correlation between knowledge level and the selective attitude, like to I do not like to wear face masks. Next, description of the relationship between knowledge and selected attitude, like wearing a face mask is too much of the hassle. Here I found R value is minus 0.61. It also shows that there was a moderately negative correlation between the knowledge level and selected attitude level. Next is description of the relationship between knowledge and selected attitude, like it is difficult to breathe when wearing a face mask. Here I found the R value is minus 0.5. So here is also found there was a moderately negative correlation between the knowledge level and the attitude score. In my study, I found the implications here in nursing education. The study result can be used in improving the knowledge in the field of nursing education. Nursing education can give information regarding use face masks during COVID-19 pandemic situation. And in administration, the nursing administrator need to organize a continued nursing program beneficial to the nursing students, nursing staffs regarding use of face masks during this COVID-19 pandemic situation. In nursing practice, the study can be used to improve nursing practice. The nurses are key persons of the health team. They should take initiatives to arrange a in-service education program, awareness program regarding proper use of face masks during COVID-19 pandemic situation. And in nursing research, the nursing educator and researcher can contribute to the refinement of the core practice. Next, come to my limitation of this study. The limitations of the study findings are the data can be collected from only one setting. So the scope for generalization is less. Limited sample size 98 restricts the finding to be generalized. Recommendations. On the basis of findings, the following recommendations have been made. A similar study can be conducted in different settings. The similar study can be conducted with a large sample size. For generalization of the study finding, a comparative study can be undertaken between nursing students and registered nurses to compare the knowledge and attitude on face masks used during COVID-19 pandemic. So I conclude my study. The study found that majority of the students have moderately adequate knowledge. However, attitude towards using face masks was lacking. Thank you.
All right, thank you, Ms. Mahuya Karmakar. You are right on time also. Well, is there any question from the participant? Not yet in the chat box. Okay. Well, is there any differences among the diploma nursing and graduate nursing related with their attitude using face mask? Ms. Mahuya.
Actually, in my study, I only include the diploma nursing students. In future, we will study on the overall nursing students, diploma, graduate nurses, and the nurses who are already registered. So in future, we will study overall, we cover overall nursing students and the nursing staffs.
Okay, Thank you for the information. Maybe in the future you will be do next research.
Yeah.
Is
Thank
there any
you.
question? Okay, not yet. Thank you, Ms. Mahuya Karmakar, for the presentation. And then we are
Excuse me,
moving.
madam. Madam, one thing. She was Monideepa Sarkar, with whom I have done the study. Monideepa
Alright.
Sarkar has presented the.
Okay. Okay. Moving to the next paper.
Next paper is mine.
All right. Thank you. Please, time is yours, Madam
Yes.
Mahuya
Thank you,
Karmakar.
madam.
Yeah.
Yes. The screen is visible, madam.
Please share screen.
Yes, I have shared. Is it visible?
Not yet.
Yes.
Not yet. Okay.
Now,
Okay.
is it visible?
Yeah, visible now. Full screen, please.
Yes.
Okay, good. Time is yours.
Yes. So I'm Ms. Mahua Karmakar from PLS Institute of Nursing, and we have done a study to know the attitude of nurses on communication with intubated patients. Intubation is a routine procedure in the critical care unit and it's often life-saving. Patients admitted in critical care area with intubation are unable to speak and face difficulty in communication. There are many studies which have reported that when patients are unable to respond verbally, nurses often do not find it important to talk with them, and nursing interventions are based on the nurse's own ideas, assumptions, and previous experience about patients' non-verbal communications, which might be wrong or insufficient. So in spite of nurses' high level of knowledge and skills, they often face difficulty in communicating with intubated patients in critical care areas. So we have taken the study as nurses' attitude towards communication with conscious intubated patients. Though nurses use various communication methods to communicate with intubated patients, still they often feel sad, helpless, hopeless, caught, and deprived when communication is ineffective. At my present place of work, informal communication with the healthcare staffs revealed that they do not have any available tools which they may use to communicate effectively with their patients except for predicting the patient's need through gestures and sign languages. The patients have conveyed that they understood what the caregiver wants to communicate, but they could not reciprocate with reply, which left them frustrated and depressed during the intubated days. The present study explored on the attitude of nurses towards communicating with conscious intubated patients. The objectives were to determine the attitude of nurses towards communication with conscious intubated patients, to develop a communication tool for nurses to ease communication with conscious intubated patients. The research question developed for this study are: what are the attitude of nurses towards communication with conscious intubated patients? So variables taken were nurses' attitude on communication with conscious intubated patients and nurses' years of experience and educational level. The study is limited to finding out the attitude of nurses to communicate with conscious intubated patients and did not focus on the practice, and physical and emotional experience for the patients or the nurses were not explored. Nurses experience assumptions were the nurses experience barrier to communicate with conscious intubated patients. Communication tool may help nurses to overcome the communication barrier with conscious intubated patients. The operational definitions of the variables are: for the study, we have taken communication, verbal communication, non-verbal communication, and intubation. The literature review was done under the headings of communication experience of nurse, communication barriers of nurse and patient with intubation, communication tools for nurse and patients with intubation. The conceptual framework for the study was based on communication accommodation theory. So this is the overall theory where individual A is the patient and individual B is the nurse, and they are interconnected with perception attributions, evaluations from the patients, evaluations from the nurse, and here I will explain. The nurse and the patient communicates where there is convergence and divergence within the intergroup demographic characteristics, because the patient, while they are intubated, they are unable to communicate properly. So convergence and divergence, most people in the world use verbal or non-verbal communication, and therefore often have the choice of which technique to use and how it can be used. So the research design, exploratory sequential mixed method research design was planned, but only interview technique schedule could be implemented at the preliminary stage, where a descriptive survey study using a self-developed validated questionnaire was conducted through purposive online data collection from May 14th to May 28th, 2021, among 154 nursing personnel with selected samples stratified across educational level and years of experience. The setting was Peerless Institute of Nursing, Peerless Hospital, and B.K. Roy Research Center. The population was nursing personnel of Peerless Institute of Nursing who are practicing in the field, as because they are post-diploma nurses. The sample size were 154 sample. Technique was purposive sampling technique. The inclusion criteria included the nurses aged about 20 years of age and those who were willing to participate. Exclusion criteria were those who are chronically ill. The research instrument used were divided into section A and B, where demographic data, which gives baseline information of year of experience in clinical nursing or teaching, and category of nurses with respect to nursing practice registration and course of studies. Structured questionnaire with 10 items on attitude of nurses, communication with conscious intubated patients were used. These are the questions, out of which there were three areas where they can mark. The validity and reliability of the research instrument were taken from 7 experts from different fields of nursing, and the data collection was done through information questionnaires, including a demographic information and structured attitude questionnaire administered on nurses through Google form, which have taken only 2 to 5 minutes to complete from 14th to 28th May among 154 nursing personnel with a selected sample stratified across their educational level and years of experience. Formal approval from the clinical director of the institution is obtained. The nurses were informed of the study aim and process. Participation in the study was completely voluntary and free from any obligation to administration or research. Furthermore, the nurses' written informed consent were taken. Data analysis was done through descriptive data analysis, where the results were like almost 90% of the respondents, nurses agreed that communication with conscious intubated patient is possible. But most, like 76% of them, face challenges to communicate with conscious intubated patients. Majority of the respondents stated the necessity to communicate with conscious intubated patients, and 92% has agreed to the requirement of a standardized communication tool to do so. 63% of the respondents have never used any communication tools so far. 70% of the respondents had never been taught to communicate with conscious intubated patients, and 53% had never asked for any such tool to ease the communication with conscious intubated patients. Most of the suggestions from the respondent for communication tool included non-verbal communication techniques with pen and paper, visual symbols, cues, etc. So these are the representation in pie chart. where 136 out of 154, that is 83%, have confirmed the need for standardized communication tool. So 76% of the respondents faced challenges to communicate with conscious intubated patients is supported by a study conducted by Hapital in 2015, who stated that in spite of nurses' high levels of knowledge and skills, they often face difficulty in communicating with intubated patients in critical care areas. Majority of the respondents stated that they need to communicate with conscious intubated patients, which findings were supported by the study, which reported that when patients are unable to respond verbally, nurses often do not find it important to talk to them. Though they desire to do so, and nursing interventions are mostly based on the nurse's own ideas, assumptions, and previous experience about patients, non-verbal communications which might be sometimes wrong or insufficient. The implication of the study, use or in nursing education, use of effective communication technique to communicate with conscious intubated patients may be included in the curriculum of various nursing programs to orient the student nurses to this area of nursing practices. Nursing management, the administrator may create good working environment and provide effective communication tool to the clinical nurses for communicating with conscious intubated patients. In nursing practices, the findings of the study would help to develop effective communication tool to be undertaken in other hospitals and settings to ease the professionals' communication skill. For nursing research, since nurses could contribute to a lot towards holistic health in the work situation, studies of this sort would help improve the quality of nursing services in critical care areas. The findings of the study cannot be broadly generalized as it was conducted only in institution. The study in only one institution. The study was confined to a small number of nursing personnel, which was also a hindrance in generalization of the findings. Participation in the study was selected through purposive sampling, and exploration of the attitude were restricted to those reported by respondents through the structured questionnaires only in a particular setting. They were not given free flow to express their attitude. Recommendations. Most of the suggestions from the respondent for communication tools included nonverbal communication like pen, paper, visual symbols, etc. So a study may be undertaken further to develop a tool including the recommendations. And exploratory mixed method sequential study may be undertaken with focus group analysis. So the conclusion is to communicate and establish a therapeutic relationship with the intubated patients is challenging but not impossible. Therefore, how the intubated patients prefer to communicate is needed to be explored and thereby improve the communication relationship between nurses and the patients by developing a communication tool.
All right, thank you, Madam Mahuya. That's a challenging paper because I'm agree with your result that we have to develop the communication tool. Is challenging for us as a nurse in critical care unit. That's a good idea, and then we have to standardize the communication tool for them, the intubated patient, conscious intubated patient. All right, is there any question directly from the other audience? Okay, so far we have right presentation. Is there any chat from the box? Not yet. All right. Thank you, Madam Mahuya, for the presentation. Moving.
Hello. Hello.
Oh, okay.
Hello. There is a one question. Hello. Actually, I have one question. This is an excellent presentation, ma'am.
Yeah,
What
please.
communication you require as expected from conscious incubator patient, and what is your suggestion, ma'am? What communication you require as expected from conscious incubation patient, and what is your suggestion?
All right. Madam Mahuya, would you answer the question from Madam Ananda?
Madam, I'm Chanda Pal. I am Chanda Pal, Calcutta from National Medical College Nursing Faculty. Hello, can you audible my voice?
Hello, Madam Ananda, we can hear your voice, but please wait. Madam Mahuya still have a problem.
Hello.
Okay.
Madam, you just on one speaker, other speaker and other microphone have to off. Maybe two in the same room, so echo coming.
Okay. Actually, I have one question from Madam Mova. She's with the excellent presentation. Question is, what communication you require as expected from conscious incubated patients, and what is your suggestion as reply?
Madam Mahuya, please answer the question.
Yes.
Yeah.
Actually, I thought there is no question. May I know the question once again, madam, please?
What communication you required as expected from conscious incubated patients?
Yes. As we have done a focus group, informal focus group study after extubation of the patient revealed that though they could hear what the nurses are telling, like they wanted to meet the patient party, they wanted to know whether they are going to come out of the ventilation, and they usually had pain. So all these things they wanted to communicate, somehow they could not communicate because there was no verbal cues or visual cues present to them. Recently also, we had a patient who came out of this intubation who was conscious. His sedation score was not very high, and he revealed that yes, he was extremely apprehensive and he wanted to communicate during the intubation periods.
Okay. Thank you, ma'am. Okay.
Thank you so much.
Thank you, Madam Mahuya, and also Madam Ananda. All right. Thank you, Madam Mahuya. We are moving to the next presenter. The topic is relationship stress level and parenting mother. The parenting mother of the children with the autism. Okay, already join. Yeah, full screen, please. Yeah. Okay, Madam Neta, time is yours.
Good afternoon all. I would like to say thank you for being an honor to meet you all here. Let me introduce myself and my team. Here I represent my team, and my team is Mrs. Diah Arini as corresponding author, and my name is Neta Meridianti Putri as presenter, and Julian Dewi, Farida, Korila Saida, and Dwi Ernawati. We are from Stikes Hang Tuah Surabaya, and in this opportunity, I would like to present our research with the title Relationship Stress Levels and Parenting Mothers of Children with Autism. First of all, I will explain about the prevalence of autism. As we all know, that the number of children affected by autism is increasing rapidly in various parts of the world. The incidence of autism worldwide is estimated to be between 6.5 until 6.6 per 1,000 children by Myers et al. 2007. How about in Indonesia? In Indonesia, it is not yet known the exact number of people with autism, but it is estimated that more than 400,000 children. For families, children with autism are burdened in itself because they require constant attention and drain energy as well as savings. This kind of situation causes prolonged stress in the family, and the coping strategy is expected to reduce maternal pressure in dealing with children with autism to carry out their parenting roles properly. The current study will be focused on the relationship between stress levels and parenting styles for mothers with autistic children at Terapis Anak Terang Surabaya. The research design was a cross-sectional study. The research was conducted on 11 until 16 May in 2015 at Terapis Anak Terang Surabaya. The subject is 24 mothers who had children with autism. The inclusion criteria in the study were mother with autistic children aged 2 until 5 years who just underwent therapy for less than 2 months and then who were willing to be respondents. The exclusion criteria in the study were mothers who have children with autism, are not cooperative, and who resign while the study was underway. This is the result of the study. From the table 1, it was shown that the age of mothers who have autistic children 20 until 35 years is 17 people, more than 35 years old, as many as 6 people, and less than 20 years old, as many as 1 person. And then, based on the table 2, it is found that the educational level of mothers who have children with autism, 11 people as undergraduate, 11 people graduate from high school, and 2 junior high school. Based on the table 3, it is found that the work of mothers who have children with autism, private as many as 13 people, housewife as many as 8 people, entrepreneur as many as 2 people, and civil servant as many as 1 person. And then based on the table 4, it is found that there are caregivers for mothers who have children with autism, as many as 11 caregivers. There are no caregivers, as many as 13 people. The table 5 shows that mothers who have autistic children with low stress are 12 people, normal stress level are 7 people, moderate stress 3 people, high stress is 2 people, and there is no very high stress. The table 6 above shows that mothers with autistic children apply democratic parenting as 10 people, authoritarian parenting as many as 8 people, and permissive parenting as many as 6 people. And then based on the result of Spearman row test, it shows the value of R 0.577 with value of rho 0.003 with a value of R 0.4 until 0.599. It shows a modern relationship, and statistically there is a significant relationship between the length of stress levels and parenting styles of mothers who have children with autism. According to Maramis 2009, the source of stress varies greatly, one of which is pressure. The pressure in caring of child with special needs is felt by parents, especially a mother. Based on the facts in the research location, almost all mothers who have children with autism and their children are currently participating in therapy programs at this time. Mothers are more dominant in experiencing problems when dealing with their children. The mothers admitted that they were very confused, panicked, sad, and stressed when facing their children. Child development problems are treated by therapists, but only for a few hours a day. This suggests that more time is spent with the family or the mother. Handling children is not enough with therapy alone, but must be continued with the family. In this condition, mothers have very complicated problems when dealing with children with autism at home. Problems related to maternal problems can be overcome with therapies motivating mothers with autism, increasing maternal knowledge about children with autism, and growing participation or involvement of mothers in helping The impact of stress experienced by mothers with autistic children will change the parenting patterns that will be given to these children. According to Ahern, 2004, high stress in parents is associated with less cooperative, less sensitive, and more intrusive parenting styles. In mothers who experience stressful situation will produce emotional reaction ranging from excitement to emotions such as anxiety, anger, disappointment, and depression. This stress can be overcome by using coping strategies needed by parents who experience high stress when caring for a child with autism. This coping strategy is expected to reduce maternal pressure in dealing with children with autism to properly carry out their parenting roles. An increasing number of research have been conducted on the coping strategies adopted by parents of children with ASD or autism spectrum disorder to cope with their stress and other mental health problems. According to a systematic review by Al-Oran et al. 2019, educational intervention programs were reported to have been effective in reducing parenting stress and improving coping mechanism among parents of children with autism spectrum disorder. Although Muslim comprise the majority in Malaysia, however, little has been published on the coping strategy used by Muslim parents of children with ASD, as well as in Indonesia. Ilyas et al. 2018 note that religious belief stand out as a very prominent culturally relevant factor in the context of Southeast Asia. So we can conclude that the stress level of mothers who have children with autism at Terapis Anak Terang Surabaya experience more stress at 20 until 35 years with low stress levels. The most dominant parenting styles for mothers with autistic children is democratic parenting. There is a relationship between stress levels and parenting styles for mothers with autistic children in Terapis Anak Terang Surabaya. Most of the stress is normal with applying democratic parenting, and most of the high stress is applying authoritarian parenting and permissive parenting. Thank you very much for your attention. May all those we have shared be beneficial for all of us. Thank you.
Unmute. Madam Devi.
I'm sorry.
We cannot hear you.
I can hear you.
Yes.
Okay, thank you, Madam Neta. Thank you for the sharing your paper with us. I see in the column chat there is no question yet, and then the raising hand. Okay, no. All right. Not yet. Okay, I think it's enough for the presentation with this topic. Thank you, Madam Neta. Moving to the next presenter, the topic is related with the implementation of electronic medical record in the development healthcare system in Indonesia, a little review. There is a presenter. Please, Madam Nuke, share screen. Okay, good. Okay, time is yours.
Okay, thank you, Miss Dwi. Okay, my name is Nuke. In our team, there are Nuka Amalia, Muhammad Zul Azri, Ana Rosarini, Dina Ripka Wijayanti, and Maya Ayu Ristiawati. And our topic is the implementation of electronic medical record or EMR in the development healthcare system in Indonesia. This is a literature review. And our team from Health Information Management Department of Sekolah Tinggi Ilmu Kesehatan Hang Tuah, Surabaya, Indonesia. Okay, first of all, the development of information technology is now growing rapidly, including in the health sector. According to World Health Organization, medical records are an important compilation of facts about a patient's life and health. Ministry of Health Regulation in Indonesia state that medical records must be made in writing, complete and clear of electronically. This proves that in the future, medical records will be developed electronically. Electronic medical record, or EMR, is the development of information and communication technology in the field of health. EMR has long been applied in the developed countries such as United States, Korea, China, England, and etc. In the developing countries, EMR is still applied in some countries. Indonesia is a developing country that not all healthcare implemented EMR. Building EMR requires careful planning because its implementation many parties will be related and focus on the needs of users. So that the aims of this research is to analyze or describe the implementation of EMR and preparations by healthcare in Indonesia. This method's literature review, we researched article from Google Scholar, and in the early stage, we obtained 28 articles, and the article was selected again according to the focus of the research. So 8 articles were we obtained. And the result is all articles mentioned that qualitative research. In Surakarta Government Hospital, in this place already has a computer-based medical record information system. Hospital Management Information System name is Pilar Hospital. In Surakarta Government Hospital, related to medical records are registration, inpatient, outpatient, emergency, laboratorium, radiology, non-operative, pharmacy, and cashier. Pilar Hospital is a desktop-based because it makes use of Microsoft Office and make it easy to use by all employees. And Pilar Hospital using security before entering the application. There are username and password that must be filled. So officers have their own job description. So not all can fill in all modules. Only 2% have access to all modules, IT and head of medical record. The IT is responsible for the running of system, including maintenance, and the head of medical records is also given access because it relates to patient data. And the next hospital is Bethesda Yogyakarta. This hospital is oldest educational hospital and private hospital in Yogyakarta. And medical records documentation service in this hospital have not been fully carried out by electronic. Eventually, this hospital claimed to have many benefits that occur when medical records are electronically. The EMR activities are conducted electronically when the doctor writes anamnesis, treatment, diagnosis in the EMR module on computer. The next hospital is Government Hospital Dr. Cipto Mangunkusumo in Jakarta. Target users of EMR, adult outpatients are doctors, nurse, medical recorders, and pharmacists. Every user will be facilitated by tablet with stylus pen or computer. EMR is built with web-based with security username and password. Doctors, nurse, and medical recorders can have every modules. And the next is PKU Muhammadiyah Gamping. The procedures medical record conventional at this hospital is too long, while EMR has a shorter procedure. In June 2018, it using two medical records, conventional and electronic. EMR was first used by a neurosurgeon in April 2018. The sectors involved in the development of EMR are management, directors, medical records, doctors, pharmacy, nurse, and IT. The implementation of EMR is carried out gradually. The trial was conducted from one doctor accompanied by conventional medical records near the computer. And this is a discussion. The preparation of EMR in Indonesia's healthcare, we can state that the preparation of EMR includes identification of the needs of medical records patients, including information needs, functional needs, and non-functional needs. Things to note in building EMR in the health service is by identification with the elements of man, methods, machine, and materials. And we can get from the literature, our literature review, that the advantage of EMR after its implementation, healthcare that have used EMR partly already feel some benefits. In Bethesda Hospital, Yogyakarta, the quality target of medical records documentation for new patients arrived at the clinic less than equal 10 minutes, and the old patients less than 20 minutes. Medical records document complaints from nurse about its distribution decrease. Besides, there are cost saving in hospital due to the savings of paper and decreased storage needs. The existence of computerized functions improves the effectiveness of the accuracy of input, storage, search, report, coordination between units, and data transmission at Islamic Jumursari Hospital. And the EMR can reduce paper usage, so the hospital can saving costs. And this is a line from Sudra that the use of EMR is expected to be able to produce quality documentation in medical reports. It can support the need of healthcare for patients and service management and be able to produce information and reports. The benefits of EMR in terms of efficiency, reliability, and care quality. And we can conclude that the implementation of EMR healthcare in Indonesia is still not fully used in all parts or units. Identification of users needs to be considered in building EMR, so that can do easily and integratedly. Although some healthcare already feel the benefits of EMR implementation, the most benefit that felt is the cost savings. So there is need the development for EMR in healthcare in Indonesia especially. Mostly, the healthcare has been working with third parties in developing EMR. Hopefully, they can develop their own if there are obstacles can be solved quickly. Thank you.
All right, Madam Nuke, thank you for share. It's a nice and interesting topic. we hope that the implementation of electronic medical record also can support the quality of the system healthcare in Indonesia and many others or in the world. All right. Is there any question from the participant? Let me see.
Hello,
Please
one
raise your hand.
question. Hello, one question. Hello.
Yeah. Yes, please.
In Calcutta, one question, madam. How you authenticate EMR? How you authenticate the EMR? Remove the personal bias.
Okay, Madam Nuka.
Okay. In the Indonesia, the EMR. Okay, thank you. In the EMR, in Indonesia is still developing, not fully in the all sector. So,
yeah.
In this healthcare in Indonesia, still need development continuously. Yes. So far, this is a literature review that we get in article. Still in Indonesia, still develop continuously, and information about this.
Okay, Madam. Do you want to have another comment, feedback? Based on this research, Madam Nuka mentioned that this is a literature study related with the EMR, and so far still under development and not fully constructed yet. And then maybe it's not cannot answer in detail relevant with your question. Do you have any feedback for this or maybe suggestion?
Hello.
Hello, madam. Do you have any comment?
No, thank you. This is a very excellent presentation. Okay. Thank you, ma'am.
Right. Thank you, madam. Well, let me check from the chat box. Not yet. Okay, I think it's enough for the discussion session. Thank you, Madam Nuka, for the presentation and sharing the information with us. Moving to the next presenter. Okay, the 11. The topic is related with the problem of adolescent and solution in COVID environment. Please join the presenter. Let me check. The team is, yeah, okay. Full screen, please. Hello.
Madam, you please go to first slide, unmute yourself.
Yeah.
And on video, go to first slide, title, and on your video and unmute. We cannot hear you, cannot see you also.
It is visible, sir.
Okay, good. Please
Topic.
start. Madam Simade, we can see and hear your voice.
Very
is
good.
yours.
My heartfelt gratitude to organizer for giving opportunity for share my knowledge on this platform. We are going through very hard, very tough situation, and which never happened in human history. In this pandemic, making huge toll in adolescents. I shall highlight the problems of adolescence and solution in COVID environment. What do you mean by adolescence? Adolescence is the age 10 to 19 years. Adolescence is a phase of maturation. It is a transitional period of physical and psychological human development between childhood and adulthood. How the brain of adolescents differ from other. It is still developing and will continue to do so until full maturation by the age of 22 to 24 years. The greatest changes in the brain volumetric areas recruit new functions like self-control, judgment, emotion, and organization. Next, what are the different types of development with relation to adolescent? Under biological development, start puberty in general, growth spurt, and reproduction related changes and changes in the brain. Next is what are the factors are affected the adolescents during this lockdown period. Stressful life events and difficulty to cope up with the situation, extended home confinement, and grief from death of near relatives, and intrafamiliar violence, overuse of the internet and social media. And are the risks of all adolescents? No. Those who have past psychiatric history, those who are girls' child, those who low socioeconomic status, and those who have ethnic minorities are at major risks. Now, what are the root of psychosocial problem? Social relationship is hampered due to inability to see the each other facial expression that lead to psychological development defect. And in this COVID situation, they are suffering from some physical and psychological problems. Physical problems are decreased physical activity, more screen time, net addiction, that is FOMO, fear of missing out something, irregular sleep pattern, and less appropriate diets that lead to obesity and osteomalacia. Under psychosocial problem, feeling of insecurity, worry about the health and work of their relatives, the sudden death, separation from the friends, for absence of school, thus lead to anxiety and depression and suicidal attention. How we can protect our child from physical inactivity? By increase their activity, walking, exercise, workout, skipping in the room, rooftop, and going uphill and downhill in staircase. Do video workout with virtual exercise classes, dancing, breathing exercise, laughing class, and indoor games. And what are the few remedies of internet addiction? And stick to schedule, set up time to wake up, exercise and shower, get dressed, have breakfast, whatever they need to start the school day, plan a mini breaks and 1 hour lunch between study hour, and declutter and donate. And what are the remedies of internet addiction? Speaking out of trace, promote reassurance, convey appropriate positive information to be safe, stress reducing action, engage in dialogue and social exchange, maintain appropriate lifestyle and social contact, avoid smoking, alcohol and other drugs. Now, diversification of low mood, exploring hobbies, extracurricular activities, plan or cook dinner, rooftop gardening, indoor planting, word making game, gentangle art, that means new art, kintsugi art, and origami, internal decoration. Take a virtual tour of museum or walk through the Grand Canyon with Google Earth and write down experiences. Tip for socialization. Some tips: try hosting a virtual dinner party with virtual guests, family get together with relatives in distance, competition of extracurricular activities like drama, like recitation with friends and family. Some health habits will be grown in home. Adequate exposure to sunshine for production of vitamin D, and healthy diet should be given child. High protein and medium fat diet. Check on comfort eating, especially sugar and processed food and natural food, and food should contain dietary fiber. Take home message: the adolescents, being the future of country, should get attention for their growing health habits and socio-psychological attributes. Several problems are added due to lockdown in novel coronavirus infection, along with the natural challenges of growth and development. Different workers throughout the world suggested valuable remedies for effective solution of each problems. Thank you. Thank you to all.
Okay, thank you, Madam Simade. That's an interesting topic too, related with the adolescent and the solution for COVID pandemic. Yeah, we will like to invite the participant to give a question, or maybe would like to share the experience. Let me check in the column chat. All right. Maybe later on, Madam Simade. Thank you for the presentation, and thank you for sharing with us. We're moving on to the last presentation. Last but not least, I would like to invite the presenter to join with the topic, awaiting another silent epidemic in COVID pandemic. Madam Ananda Kishorpa, or maybe the other team. Please prepare the PPT. Yeah. Hello, still unmute. We will invite the presenter with the topic, awaiting another silent epidemic in COVID pandemic. Please, the presenter, prepare the share screen. Okay. Full screen, please. Okay, good.
Hello.
Yeah. Please proceed. Time is yours.
Okay. A very good evening, all of dignitaries present in this platform. I am feeling heartfelt gratitude to this organizer of the conference for giving me the opportunity to present my topic in this platform. Today my topic is waiting for another silent epidemic in COVID pandemic. Today the world is locked down due to novel coronavirus infection. So overall, over 1/3 of humanity is subject to some form of respective physical activities in lockdown. This strategy has been proven effective for lowering the disease load of the COVID-19 outbreak. Now, our concern of reduced physical inactivity in lockdown period. Overall physical inactivity attributable disease burden lead to remarkable higher risks of the disability, which is associated with a nearly 24% increased risk of mortality among the general population. COVID with comorbidities also increase the mortality. Now the effect of prolonged lockdown leading to restricted mobility in COVID pandemic. First effect, less physical activity or workouts, less exposure to sunlight, then difficulty to isolate themselves, difficulty arrange for healthy diet, and also difficulty to sufficient earning or work from home. To reduce stress and anxiety, they will be more prone to smoking, also drinking alcohol without eating a nutritionally balanced diet. So in this way, this lead to the some diseases. Number one, the obesity. Number two, chronic illness. Number three, poor bone health. Number four, cancer. Then what is overweight and obesity? Body mass index above 25 kg per meter square, that is overweight, and body mass index above 30 kg per meter square is the obesity. Now overweight and obesity increase the risks of many diseases such as diabetes, cardiovascular disease, pulmonary embolism, cancer, low back pain, osteoarthritis, and also the disability. Now chronic illness developed from attribute interruption of physical exercise and prolonged inactivity. This lead to the insulin, resulting in diabetes mellitus, muscle atrophy and bone loss, resulting osteoporosis, increased blood pressure leading to hypertension, fatty liver or dyslipidemia leading to chronic liver disease, decreased aerobic capacity, which is resulting the high risk of collapsing upon resuming the exercise. Is there a common link with all problems? Yes, that is vitamin D deficiency. Apart from sunshine, other cause for vitamin D deficiency of Indian population, that is genetic factor, more number of hours spent indoor, cultural and traditional habits, increased pollution, and change food habits. Normal classification of the vitamin D deficiency, that is the assessment. Normal vitamin D level in the blood, optimum level 30 nanogram per ml, insufficiency 21 to 29 nanogram per ml, deficiency below 20 or below 10 nanogram per ml. Now the blood vitamin D normal vitamin D level is 30 to 100 nanogram per ml. Average vitamin D level in Indian population below 10. This is the shocking news for us. Now, according to the AIMS, New Delhi, Indian 2019 reports, 96.7 Indian population is suffering from vitamin D deficiency. This bar diagram shows that all Indian professionals, that the soldier, nurse, pregnant women, newborn, and office staffs, doctors are suffering from the vitamin D deficiency. Our study with the 113 individual more than 50 years of age after lockdown, we found 86 sample, that is 76% individual are as osteoporotic, of which 10% of male and 19% of female. Now I discuss how the ultraviolet B ray produced in our body through sunlight. Ultraviolet B ray of sunlight converted free vitamin D3 to vitamin D3 initially goes to the liver through the blood circulation, and they produce 25 hydroxycholecalciferol. Then it goes to the kidney through blood circulation and produce 1 to 125 dihydroxycholecalciferol, which maintains structure of bone and muscles. So deficiency of vitamin D produce osteoporosis. Now this is the normal bone, this is the osteoporosis bone. Osteoporosis bone means porous or fragile formation from the bone. What this is the all are the osteoporotic fractures. Now overall mortality with the vitamin D deficiency, severe vitamin D deficiency lead to type 2 diabetes patient, which is increased risk of cardiovascular mortality. In addition, osteoporotic fracture and injury, surgery related complications, immunity deficiency leading to infection can also increase the risk of mortality in 68%. Now, what some individual are affected more than others? Some several factors, variables depends on that. One, sunlight. number 2 skin texture, number 3 skin sunscreen, and obesity. Effects of sunlight. Seasonal variation. In winter season, November to February, more oblique zenith angle of the sun ray produce less ultraviolet B. Maximum ultraviolet B produced 10 AM to 3 PM. That is called diurnal variation. Now the social custom. Clothing and sunscreen with sun protection factors effective prevents D3 production above 30, effectively prevent D3 production in the covered areas. Skin tone and age. People with darker skin need to spend more time in the sun to produce vitamin D than those with lighter skin. Age can have an impact as well. As you get older, vitamin D production in your skin become less efficient. Obesity cause relatively vitamin D deficiency of vitamin D. 4 to 400 nanogram per gram vitamin D2 and D3 can be stored in abdominal fat. So abdominal fat can increase the risk of vitamin D deficiency. So what the solution? According to solution is medicine. According to AIMS study, New Delhi, India, oral cholecalciferol 60,000 international unit, D3 1 tablet per week for 8 weeks, followed by maintenance 2000 international unit daily therapy for 4 months, placebo duration of the treatment of 6 months, including vitamin D supplementation. Sunshine therapy, 10 to 30 minutes of around 1/3 of the area of your skin to midday sun is enough to make plenty of vitamin D for lighter skinned individuals. It also perfectly fine to wear a hat and sunglasses to protect your face and eyes while exposing other parts of your body. Now I am highlighting the dietary tips. Fatty fish and seafood containing highest in vitamin D. Mushroom are the only vegetarian source of vitamin D. Wild biotech mushroom provides as much as 2000 to 348 international unit per 100 gram serving. That's almost 300% of the recommended dietary intake. Sunday ho or Monday roj khao one day. That is egg yolk are the another source of vitamin D. Eggs from the pasture raised or free range chicken, often up to 4 times more or up to 20% of the recommended dietary intake. Ideal diet for the overweight and obese. To reduce the overweight, we have to choose hypocaloric diet. Hypocaloric diet means reduce total fat content, low carbohydrate and high protein foods, increase intake of dietary fibers. For enhancing immunity, a diet enriched with immunomodulatory foods such as pro and prebiotic and some vitamins, that is vitamin A, C and D. Remedies to prevent obesity, hyperglycemia and hyperlipidemia. For this reason, we have to do regular moderate physical activity. Physical fitness can also help reduce the risks of acute life-threatening events. To maintain these effects sustained optimally lifelong, physical activity is required. According to WHO, moderate intensity aerobic physical activities not less than 150 minutes per week or vigorous intensity aerobic physical activities not less than 75 minutes per week. These moderate activities are walking, cycling, swimming, gardening, dancing, and household working. Muscle strengthening activities involve major muscle groups for 2 or more days on a weekly basis. Other studies recommended that other study shows that possible outdoor activities including walking, jogging, and cycling, sensible sun exposure can reduce the osteoporosis. Home-based exercise Tai Chi exercise, that is the lancing and dancing exercise with the help of music. Staircase walking, muscle strengthening exercise can be carried out using the elastic band. Aerobic and free hand sit up, push up, exercise, etc. Don't do the excessive exercise. Now this is the general conditioning exercise for all, aerobic exercise for all, focal muscle strengthening exercise for young, for elderly and fit person, Tai Chi exercise as a freelancing and dancing with music, use of stair cases with a folding bar, how to control post-meal rise of glucose and lipid in the blood, for reduce of blood glucose level, 15 minutes of post-meal walking, 6 minutes of stair climbing and descending, for reduce of blood lipid, 3 times 10 minutes of brisk walking at a day, reduce triglycerol concentration by 16%. Now take home message. Lockdown for novel coronavirus lead to lack of physical activities and lack of adequate sunshine lead to vitamin D deficiency. Another several diseases arising out of the vitamin D deficiency, osteoporosis is the most common, as we found 76 of our patients, which is spreading like silent epidemic, causing severe health issues, morbidities and mortalities. Therefore, multimodal measures are required, including medication, specific diet plan, activities, exercise, adequate and optimum sun exposure, apart from the vitamin D supplementation. Thank you. Thank you all.
All right. Thank you, Madam. That's a good and interesting. This is also applicable for us related with the effect of the prolonged lockdown. Thank you for your share and solution. So this is a influence and also impact to us and try to apply at home. Your take home message is very useful. Physical therapy, sunshine therapy, dietary therapy, and also the other on. That's interesting. Well, there is one chat question related with the measurement of the adequacy of the vitamin D in your research. Would you share the question from Madam Habibia?
What is the question?
What is the question?
The question is, how do you measure the adequacy of vitamin D in your research?
That is the blood. I have taken blood sample from the outdoor during lockdown period. I have taken the 113 sample, and I have blood through blood. Taken the blood sample, then I have done these things. The vitamin D deficiency.
Okay, I think the answer is enough from.
And I have one question actually, Madam. Do you have checked any relationship with thyroid?
Yes,
no.
Definitely. In this study, no.
In this study, I will know. I was not done, but in future I will be done this one.
So this is a very good question, Dr. Poddar. So just being a co-author, I am going to answer this. So yes, you are right. That's it. Hypothyroid is very much associated with osteoporosis. So basically there are some comorbidities, of which the hypothyroid is one of the most important cause, which leads to hypovitaminosity. So that is the part of the study. We'll actually include what are the comorbidities specifically associated with the osteoarthritis in the next part. Thank you for.
Yes, actually, sir, this one, hypothyroid and abdominal fat, both is indicated to me. So I am very much concerned with this study. Thank you.
Okay. And one important thing, just I will highlight, the abdominal fat is basically it acts as the irreversible sink for the vitamin D. So you can have vitamin D adequately in your body, but as the fat is the basic sink, irreversible sink of the vitamin D, in spite of having your adequate vitamin D, that vitamin D is stored in your abdominal fat, and that is unavailable in your system. So it is what is the amount of the active vitamin D is very less, which is actually responsible for the osteoporosis. So in spite of having the adequate vitamin D, so you are deficient. That is the relative deficiency. That is the very worst news.
Okay. So very depthful study we have to do on this later on. Thank you, sir. Thank you.
I was wondering. So the consume the vitamin D is one of the recommended solution when we are in lockdown movement, right? This. What do you think, madam? So it is recommended, right? We consume the vitamin D during the lockdown.
It is routinely recommended in the COVID situation because we are in lockdown. So each and every person will take the vitamin D as well as the vitamin D capsule or as well as the vitamin D supplementary diet. Okay.
Actually, that's a very interesting question as you have. Being a author, I'm going to answer this. Vitamin D is required not only for the bone and muscles, but it also a significant action as anti-inflammatory action. That is for an immunomodulatory action, which is very important. So as you all know that the in COVID scenario, some persons are going to have a significant cytokine storm. Some persons doesn't have. So some older persons, they have become escaped from COVID infection, whereas some young persons are affected with significant cytokine storm. So that is because of this inflammatory reaction, innate inflammatory reaction, and the vitamin D actually that increases this immunomodulatory action. Those who have hypovitaminosity, they can be being susceptible to that inflammatory reaction. So that is why it is recommended that vitamin D is required not only for the bone and muscle strength, but also recommended for increasing the immunomodulatory action to fight against COVID infection. Thank you.
Oh, okay. Thank you, Prof. Ananda. Thank you for the recommendation for us. Well, finally, we come to the end of this open paper presentation today. Thank you, Madam Chandrapal and Professor Ananda. Thank you to all the presenter for the bright sharing and the participant. Please give applause to the presenter and their team. Remember that we have to fulfill the attending form for today and the evaluation of the activity in the chat box. Thank you for joining with us. And then Dr. Sandip, Professor Sandip, please, maybe you have an announcement.
Thank you so much, sir.
Yes, thank you. Thank you all participants, and still in the evening, now already more than 100 participant is watching, and also YouTube also many person watching. Thank you all to participate in this pandemic condition. India and also Malaysia is in total lockdown condition and very bad condition here now. So we wish that you all stay safe. I have seen one slide. It's showing that washing hand with soap solution, very good presentation, and this should be highlighted. Of course, we have to take care, and many participants also ask that if what is the if the health workers taking proper precaution or not, they are reluctant or not in India, what is the condition like that they have asked. So I have answered in the chat box. So we are, of course, many person not following and many person trying to follow, and many person don't have the instrument to follow, means they don't have the facility to follow. So there are many different types of people we are having. So we are in a very tough condition, but we are trying to work on the situation with total effort. Thank you all again. Tomorrow we will meet at 10:30 Malaysian time and Indian time 8 a.m. with the plenary session with Professor Smriti Mani. And after lunch there will be, I have broke down because Egypt, Dr. Emil is there. After lunch he will speak. So in between there will be open paper session. Thank you. Stay safe. Thank you for sharing. Thank you, Ms. Devi and the co-moderator. Please. Thank you.
Yeah, thank you very much, Prof. Sandeep, and thank you for the participant. See you tomorrow, and then the time as scheduled. Bye-bye.
Bye.